Okay, so we will move forward and start our training now. Welcome to all of you and welcome to the panelist experts. They are joining us from our Center of Excellence, Indian Institute of Public Health, Gandhinagar, and also NRDC, Natural Resource Defense Council. So we will be covering topics ranging from global warming, climate change and its health impact, health action plan and lessons from Ahmedabad heat action plan. We will be covering heat island effect and assessing heat threshold at the city level and establishing triggers. And we will also discuss implementation of action plan and also surveillance that we are running in 23 heat vulnerable states during summer months, starting from March to July end. And we will also be covering measures on health facility and community resiliency to extreme heat. There will be also a Q&A session, so you can raise your hands or you can mention your questions in the Q&A session or chat session, and we will try to answer them through panelists. So to begin that session, I should mention that most of you are aware that we have next year action plan on climate, on heat-related illnesses. We have distributed it before, and I will also share a link in the chat box. And based on that, we'll be doing this training. There will be also some training modules that are prepared with us, and we will be sharing with you in coming days after due approval process. So those training modules will be the pillars for the training being conducted now on. So with that, I will hand over the session to Indian Institute of Public Health, Gandhinagar. They will be covering background of the training. I think Dr. So Dr. Professor Mahavir Golecha has a master's degree in health policy planning and financing from London School of Economics and Political Science and diploma from London School of Health and Tropical Medicine, UK. He's a professor in IIPH and involved in research in area of environmental public health, healthcare financing, health systems and health policy, and he will take us through the background of the training. Over to you, Dr. Mahavir.
Yeah, thank you very much, Dr. Purvi and NCDC team for organizing this training of trainers. I think the participants are state nodal officer and nodal officer at district level. So in the background, that Indian Institute of Public Health, Gandhinagar is designated as a center of excellence for heat health. By
sorry to disturb, Dr. Mahavir. You need to come closer to mic. Your voice is little low.
Okay. So now it's audible.
Little better.
Okay. Okay, so thank you very much. I would like to thank NCDC and the team National Program for Climate Change and Human Health for organizing this training of trainers. And I think prospective participants are state nodal officer and district nodal officers. So Indian Institute of Public Health, Gandhinagar is designated as a center of excellence by NCDC for heat health. IIPH Gandhinagar is working in the area of heat health and environment public health since last 1 decade, and also pioneered the South Asia's first heat action plan in collaboration with AMC and NRDC in the city of Ahmedabad. So basically, the purpose of this training to build the capacity of state nodal officer, so they can understand the importance of heat action plan, how climate change is affecting human health, and what are the various challenges due to climate change our cities are facing, like urban heat island, and what are various strategies needs to be implemented. For example, early warning system based on threshold determination, and also various standard operating procedure for basically implementing heat action plan. What action needs to be taken during pre-heat season and during summer, and what are the various activities or monitoring and evaluation needs to be undertaken after implementation of heat action plan. So in this training, we will basically cover various topics as mentioned by Dr. Purvi as well, that what is global warming, how basically climate change and is affecting our health, with how extreme heat events are increasing mortality and morbidity due to heat waves. So Dr. Abhiyan Tiwari is working with right now with NRDC, will be covering this. And then Professor Dilip Mavlankar will cover that how Indian Institute of Public Health Gandhinagar collaborated with local city municipal corporation and NRDC and some international partner has developed and implemented the South Asia's first heat action plan in the city of Ahmedabad, and that has given significant results, significant outcome, and that led to reduction in mortality and morbidity due to heat wave. And same has been also called as an ideal heat action plan by the National Disaster Management Authority. Then we will also cover that why assessing the heat threshold is important, how urban heat island effect is created in the city, and what are various strategies which can lead to reduction of impact due to urban heat island, and how a early warning system can be implemented. Then we will cover that basically what is heat action plan, what is framework of heat action plan, what are various standard operating procedure for implementing heat action plan, and surveillance system, monitoring and evaluation system developed by the NCDC. Then Mr. Polas Mukherjee from NRDC will also cover what are various actions and measures required for improving resilience of health facility due to extreme heat event. Then I'll introduce a group work which participants need to do on their own, and they can submit their assignment and we can evaluate the same. So we will give you the dummy data of temperature and mortality. Then you have to correlate that how temperature is affecting the mortality. We will give you data of 3 cities or 3 blocks. So you have to identify which block is more affected with extreme heat event. And then finally, we will be having a question and answer session. And then if you have any query, you can raise your hand, and you can also write in chat box if it's available, or you can raise your hand. Now I request Dr. Abhiyan Tiwari to please start his session on global warming, climate change, and health impact of heat. Dr. Abhiyan Tiwari, please.
Thank you so much, Dr. Mahavir Golecha, sir. Thank you so much, Dr. Purvi Patel from NPCC, for giving me this opportunity to talk on this very important issue that IIPHG and NRDC and NPCC together have been working for past several years now. I'll start with sharing my presentation. Can you see my presentation, sir?
Yeah, it's visible.
Okay, thank you. Okay, since you have already said that it's visible, in this first session, I'll be talking about the global warming health impacts of extreme heat. And since now we have been in this era of pandemic, these becomes the most pertinent questions, whether I'm audible or not, and can you see my screen? I think both of these questions are already addressed. So again, thank you so much for giving me this opportunity. Going ahead and talking about the global warming, there is one thing that we should definitely talk about is the greenhouse gas effect. I understand that our participants are from varied background, starting from the state level officer, health officers who are state nodal officers in our program, and then also district officers. And then we also have some medical officers who are from taluka level or even at PHC-CHC levels. So I welcome all of them, and considering their varied background, I have tried to keep, the presentation content of this presentation, which can be related easily by anyone who is attending this. And I'll be using English as the primary language, and in between मैं हिंदी में बात करता रहूँगा, so that by and large हम लोग समझ सकें क्या present करना चाह रहे हैं हम लोग इस presentation के through. So global warming से पहले we should talk about the greenhouse gas effect. What exactly is that? Greenhouse gas effect is nothing. It's a natural phenomena. Our atmosphere has certain gases which are carbon dioxide, even the water vapor, methane, NOx. These are the primary greenhouse gases that what they do, they trap the solar radiation that re-radiates from the Earth's surface, and they trap some amount of that emission and sends it back to the Earth, which keeps our atmosphere, the temperature of our atmosphere at the level which is necessary for humans and us to survive. But this is natural phenomena. What we have done is we have increased the concentration or amount of this greenhouse gas effect, greenhouse gases, by burning fossil fuels and by emissions over past several decades and century, which has made this phenomena a bigger concern. So now the sun radiation that comes to the Earth gets redirected, re-radiated towards the atmosphere, but the increased amount of greenhouse gases that the humans have emitted over past several years traps it back and is what increasing the atmosphere or the temperature of our atmosphere and surface is higher, what we call greenhouse gas effect, responsible for global warming. Greenhouse gases, they are emitted both from natural and man-made sources. Some of the man-made sources, if I talk about the major contribution, comes from the electricity and heat production, from the transport sector, from the agriculture sector, industries, and so on. Who is emitting these greenhouse gases highest? We can clearly see there are difference between the per capita emission and there are difference between the overall country emissions. Definitely countries like India are falling in the top, among the top emitters. But if we go by the per capita emissions, we can see there are countries like Saudi Arabia and China which are among the top emitters and not the India. इसके बाद हम बात करते हैं, जब हम ग्लोबल वार्मिंग की तरफ जा रहे हैं, थोड़े और बेसिक टर्मिनोलॉजीज की बात कर रहे हैं. We often use these terminologies very interchangeably, like weather, climate variability, climate change, but हम उसके बीच में फर्क क्या है, we often don't think about it. So weather is an atmospheric condition like temperature, precipitation, humidity, wind, etc. that we experience in a short duration or rather on a day-to-day basis. जो हम रोज experience करते हैं वो weather है. But what we expect at a longer duration or on average is what we call climate. So climate is what we expect and weather is what we get, if I can put it in a simple way. Duration की बात करूँ, weather, it ranges from hours to days to months, whereas the climate variability, which El Nino, La Nina, आप लोगों ने बहुत बार frequently ये terminology सुनी होगी, that ranges from a duration of months to decades. And then there are phenomena like sea level rise, ocean acidification, even the global warming that we talk about. Those are the phenomena of centuries and decades and centuries, which we also refer as responsible or the outcomes of the climate change. So what does average mean? Climate is an average weather condition over a time. For example, अगर मैं गुजरात के climate की बात करूँ, so it's a hot semi-arid climate. But there are other, there are weather conditions also in Gujarat. एक monsoon season होगा, एक winter season होगा, एक summer season होगा. But overall, अगर गुजरात का climate कैसा है ये पूछा जाता है, तो part of the Gujarat is by and large hot and semi-arid climate in nature. And global warming refers to an average increase in Earth's surface temperature. So global warming refers to an average increase on Earth's average temperature over past several decades. There is no doubt on that. Am I audible?
Yes, you are audible. Yeah,
okay. Thank you, sir. Yes. So there is no doubt on that. The entire world is on agreement that the temperature has been rising over a period of time. All the observatories, all the national, international, global atmospheric and climate observatories and institutions have agreed upon this, that we have seen a steady rise or a consistent rise in our global average temperature. And there has also been a similar trend that we have seen in the concentration of carbon dioxide in the same trend, where we see the increase in the temperature. And there is something that happened in between the period of 1850s around, which any one of you can also answer in the chat कि क्या हुआ था इस period में जिसके बाद अचानक से we have seen this rise in the temperature. So let's keep it interactive. अगर आप लोग chat box में interact करेंगे तो we'll also get to know who is with us or not. So I'll hopefully look forward to your responses in the chat box later. So yes, now when we talk about कि average temperature बढ़ रहा है, average temperature बढ़ रहा है, तो average temperature जब पूरे साल का बढ़ता है तब हमारे जो average summer days हैं या heat days हैं या extreme heat days हैं वो भी बढ़ रहे हैं, right? So rather than having equal amount of cold days, extreme cold days, moderate temperature days, and then heat and extreme heat days, now what we are seeing is more heat days and more extreme heat days over a period. And not just that, this average increase in the global temperature, which is also using climate change, is leading.
Abhyant, we can't hear you. Huh? The voice is getting cut.
Wildfires, sea level rise, floods that we have seen. Now, sir? Hello?
Yeah, better.
Okay. Yes. So, and not just, these weather conditions, these extreme weather conditions, but definitely extreme temperatures. So now our heat waves are becoming more intense, more long lasting, more frequent. In fact, अगर इस साल की भी मैं बात करूँ तो इंडिया ने पिछले 122 साल का, जब से इंडिया ने रिकॉर्ड कीपिंग शुरू किया है वेदर का इंडिया में, तब से लेकर के अभी तक का सबसे गर्म साल इस साल का जो मार्च महीना था. इनफैक्ट अप्रैल, पार्ट ऑफ अप्रैल वाज आल्सो अमंग द हॉटेस्ट इन द हिस्ट्री ऑफ इंडिया. आप लोगों से मैं एक लिंक शेयर कर रहा हूं इन द चैट बॉक्स, एंड आई वुड अर्ज ऑल द SNOs, खास करके जो स्टेट नोडल ऑफिसर्स हैं, मैंने चैट बॉक्स में एक लिंक शेयर किया है. इफ यू कैन सी दैट लिंक, आप सबको चैट में आएगी. उन सबसे मेरा आग्रह है कि आप उस लिंक को ओपन करिए. आप अगर ये कोई डिसमिस करने का या स्किप करने का ऑप्शन देख रहे हैं तो रिक्वेस्ट यू आप उसको डिसमिस करिए या स्किप करिए. दिस इज अ पोल, लाइव पोल, which will be able to see your responses on it. So once you will go to that link, it will open up this page on your mobile or on your laptop, where if you see an option of dismiss or disagree or skip, just press these options, and hopefully with that you'll be able to get to this poll, name of your state. आप scroll down and submit press करना है आपको. Okay, we already started getting the response. Madhya Pradesh, Bengal. Okay, I hope आप लोगों को response दिख रहे हैं. महावीर सर, आप देख सकते हैं response?
I have also entered Gujarat.
जी सर, आप response देख पा रहे हैं कि नहीं slide?
Yeah, I can see.
Okay, the live poll. Okay sir. So at least 25 से 30 तो हमारे SNOs हमारे साथ ज्वाइन हुए होंगे, and we still only have 21 responses. तो this also shows कि हम कितना actively participate कर रहे हैं. Great. So a lot of participants from Madhya Pradesh, Uttar Pradesh, Andhra से हैं काफी लोग सर. Yes, गुजरात से काफी लोग हैं, which is obviously very good. Nice. Let's go ahead with the next slide. What I wanted to understand is आप जिस स्टेट से आते हैं वहां पर हीट का क्या कंडीशन है. Have you ever seen के ओवर अ पीरियड आपके स्टेट में टेम्परेचर, एवरेज टेम्परेचर में कितना इंक्रीज आया है? फॉर एग्जांपल, आई कम फ्रॉम गुजरात स्टेट and this is the slide of the temperature strips, or what we call show your temperature stripes, which you can also create using the link that you can see here, or if you'll just write down on your Google show your stripes, you'll be able to go to a page which will help you create the temperature anomaly or the average temperature that has changed over a period in your country, in your state, in some cases even your city. So एक बार जाके देखिएगा कि आप जिस स्टेट से आते हैं, क्या उस स्टेट में अगर आपको लगता है कि मैं नॉर्थ से हूँ और वहां पर टेम्परेचर इज नॉट अ मेजर कंसर्न, हीट इज नॉट अ मेजर कंसर्न, क्या हीट पिछले एक दशक में, पिछले एक सदी में या एक सेंचुरी में अगर कहें वो बढ़ी है या नहीं बढ़ी है. दिस वुड बी एन इंटरेस्टिंग फाइंडिंग टू गो फॉर, एटलीस्ट फॉर जाएं एक बार इसको देखें कि क्या इज लिविंग इन. इफ यू आर स्टिल ऑन दैट सेम लिंक, अब आपको ये नेक्स्ट क्वेश्चन दिख रहा होगा वेयर यू विल बी एबल टू आंसर वन ऑफ द ऑप्शन के एड्रेसिंग एक्सट्रीम हीट इज रिस्पॉन्सिबिलिटी ऑफ whom. जो एक्सट्रीम हीट का इश्यू है, या अगर मैं हीट वेव कहूँ, वो किसकी रिस्पॉन्सिबिलिटी है, उसे किससे डील करना चाहिए, हु शुड बी रिस्पॉन्सिबल टू एड्रेस इट. हेल्थ एंड फैमिली वेलफेयर डिपार्टमेंट, नेशनल डिजास्टर मैनेजमेंट अथॉरिटी या स्टेट डिजास्टर मैनेजमेंट अथॉरिटी, इंडिया मेट्रोलॉजी डिपार्टमेंट जो हवामान खाता जिसे बोलते हैं, या ऑल ऑफ द सोसाइटी. हर डिपार्टमेंट, हर जो सोसाइटी का तबका है, हर ऑर्गेनाइजेशन जो है, उनका कुछ ना कुछ रोल है एड्रेस करने में इसे, या इसे डील करने में. एक अंग्रेजी में एक फेमस इडियम है, द ट्रेजेडी ऑफ कॉमन्स. जब वो सबकी रिस्पॉन्सिबिलिटी होती है तो फिर कोई अपनी रिस्पॉन्सिबिलिटी नहीं लेता. But I see majority of responses, rather all the responses to this question going to only one option, which is all of the society. So we all think that addressing issues of extreme heat is the responsibility of all of the society, all of its institution, which in a way is true. So, or rather I should say public health, there are definitely which are heat illnesses, direct heat related illnesses, if I can say, जैसे कि dehydration हुआ, heat stroke हुआ, heat syncope हुआ. Heat stroke is the worst case scenario. I don't need to from underlying comorbidities. For example, during heat season we see more number of cardiovascular disease or cardiovascular morbidities and deaths incidences. Respiratory disease के incidences, chronic COPD के cases में exacerbation का cases बढ़ते हैं during summer. And there are other chronic diseases also, like chronic renal disease, or even the mental health conditions also gets deteriorated during the extreme heat period. Hospitalization, definitely हम hospitalization and all cause death में average increase देखते हैं during the period of extreme heat months in the summer. Health services पे क्या impact होता है? There is definitely an increased ambulance call. Maulanka sir and Mahavir sir will talk about that more in detail. Other injuries, even work related accidents, even road traffic accidents में increase हमको देखने को मिलता है. There is a shortage of power, there are shortage of water supplies, transport department affect होता है, productivity affect होती है. Overall अगर हम कहें कि हेल्थ सिस्टम के ऊपर हमारे एक इसका इम्पैक्ट डायरेक्ट एंड इनडायरेक्ट देखने को मिलता है. देयर इज अ फेमस code called by the Lancet countdown on which tracks the progress on health and climate change, which called in 2021 that it's code red for health, and that is because the impacts of climate change on health. Particularly in 2020 itself, adults with more than 65 years of age were affected by 3.1 billion more days of heat exposure than the average of 1986 to 2005, which means there has been steady rise in exposure among all the population towards extreme heat. There has been steady rise in loss of labor hours. What does loss of labor hours means? Loss of labor hours also means loss of wages. Loss of wages also mean poor will not be able to afford their healthcare needs, including the needs that could arise from the impact, direct or indirect impact of the extreme heat. And unfortunately, it's the agriculture sector and it's the low and middle income countries which are getting affected more as compared to the upper ones. In terms of direct deaths that can be attributed to extreme heat, hundreds and thousands of deaths are occurring because of exposure to extreme heat. These are the estimates from 2019 itself, but the trend has been same for previous years and has been increasing steadily. So it's not code red for health now, which the Lancet has, called out, but it has already been a code red for health. For example, this is a very famous picture from 2015 heat wave in India. I guess this went viral. It's a picture from outside. The AIMS hospital in the road got because of the extreme heat. And if this can happen, how can we imagine that the health won't get affected? And the same year, the heat, after in the last months of the last weeks of the May, affecting central and western, eastern, and even the southern parts of India, also affected Pakistan in the early months of the June. And the situations were even more bad, disturbing in Pakistan, where even the morgues were running out of they were also running out of the out of room, and they had to put such signage. This is the real signage from a morgue. एक मुर्दा घर के बाहर ये बोर्ड लगा हुआ था that sorry, there is no space for dead body. So there should not be any pinch of doubt that heat cannot affect us or anyone or any part of the world. It's affecting everywhere. Even if I go by the top deadliest disasters in past decade, heat wave still stands among the top 5th and 6th and 7th rank. For example, the famous 2003 European heat wave, which accounted for more than 70,000 lives in Europe, and in Russia also in 2010, which accounted for more than 55,000. Even the estimates from this year's heat wave from the Europe that are coming are also estimating more than 50,000 deaths that can be attributed to extreme heat. And these are the numbers from the developed nations, which still consider that they are undercounting the impact of extreme heat on health. And so if this can happen, these could be the numbers from the developed nations, which has far better healthcare infrastructure and facility than those which are underdeveloped or are in developing state like us. What could be the impact? Is our responsibility actually being from the health sector to quantify as appropriately as we can. And this is a video from Ahmedabad 2010 heat wave. I'll probably just show it quickly and then
અમદાવાદ શહેરમાં ગરમીએ માજ હમકી છે. અસહ્ય સમય માર્ગો સુમસામ ભસતા લોકો ગરમીના પ્રકોપથી અસહ્ય ગરમી અને લૂ લાગવાના કારણે અમદાવાદમાં 200 થી વધુ લોકોને હોસ્પિટલ ભેગા કરવા પડ્યા છે. આપ જોઈ શકો છો શહેરની વીએસ હવાઈ રહ્યું છે. અહીંયા દર્દીઓને તાત્કાલિક સારવાર માટે શરીર પર બરફ ઘસાઈ રહ્યું છે, તો કેટલાક દર્દીઓના શરીરે પાણી ભરેલી થેલીઓ મૂકી દેવાઈ છે. લૂના દર્દીઓની સંખ્યા વધતા હોસ્પિટલમાં બરફની પાટો મંગાવવી પડી. લૂના દર્દીઓની સંખ્યા વધતા છે અને તે માટે 108 ઇમરજન્સી એમ્બ્યુલન્સ સેવા અપાઈ છે તો फायर ब्रिगेड ની एम्बुलेंस बहनों ने પણ 23 गाड़ियां तो थी सही 3 गाड़ियां हैदराबाद में इसको कैटर कर रही है जितना जल्दी उसको कोशिश कर रहे हैं हमारी एम्बुलेंस में आपको मालूम है ग्लूकोज वायरस सब कुछ है और कई पेशेंट्स को ऑक्सीजन की भी कंडीशन पे ऑक्सीजन भी दे रहा है अहमदाबाद में पड़ेली रेकॉर्ड ब्रेक गर्मीए मानवीना हाल बेहाल કરી ગયા છે તંત્રએ ગરમીના પ્રકોપ સામે સજ્જતા કેળવી છે અને આ માટે વિશેષ તકેદારી રાખવાની સૂચના આપી દેવાઈ છે નીરવ ગોવાણી ટીવી9 અમદાવાદ
तो ऐसा नहीं था कि हमने सिर्फ कोविड के वक्त हमारे इमरजेंसी रूम्स में ऐसी सिचुएशन देखी थी, बल्कि ऐसी सिचुएशन अहमदाबाद जैसा शहर जो कि एक एडवांस्ड और डेवलप्ड शहर माना जाता है देश का, वहाँ भी ऐसी सिचुएशन हीट वेव की वजह से भी क्रिएट हो सकती है. सो इट्स नॉट जस्ट कोविड दैट कैन ओवरवेलम आवर health facilities or our system, but it can any day or it can anytime, any year be the extreme heat also, which can do this to us, to our health system. So one thing that we definitely should not do is to underestimate the impact that the extreme heat can make, and which it will certainly make if we are not prepared in years to come. So with this, we all together must have to act now to manage the unavoidable, which we call we have to adapt with, because what extreme heat we are seeing now is the result of 1.1 degree Celsius warming that we have already done, and we'll also have to work together to mitigate or to avoid the unmanageable, which will see if we don't control the warming to reach 1.5 or 2 degrees Celsius in the times to come before it's too late. I think with this, I'm on time with my first presentation, and if the time will permit, we'll have the question answers later. Thanks.
Thank you, Dr. Abhyant Tiwari. I think we will move with the next session and come back to you again for heat island and heat threshold matter. So right now we will move to Dr. and Professor Dilip Mavlankar. He has been heading the Indian Institute of Public Health, Gandhinagar, as its director since 2012. After his MD Community Medicine training in Ahmedabad, he accomplished MPH and DRPH from Johns Hopkins School of Hygiene and Public Health, USA, and he has pioneered the South Asia's first heat action plan in city of Ahmedabad. And he is actively involved in the research and advocacy in the area of maternal and child health, environmental public health, health systems, and health policy. So now over to Professor Dr. Mavlankar.
Thank you very much, Dr. Purvi. Can you hear me?
Yes, sir, very well.
Shall I start with my sharing of my presentation? So first of all, let me thank NCDC, Dr. Akash Srivastav and Dr. Purvi for organizing this and allowing us to share our experience. What I will do in next 20-25 minutes is to share with you the experience of implementing a heat action plan in Ahmedabad city, along with the municipal corporation and other partners, which are all listed here. I will come to it in the at the end. Are you able to see my screen?
Yes, sir, but it's not in slideshow mode.
Yeah. Now is it okay? Are you seeing in the slideshow mode?
Yes, yes.
Yeah. So let us begin. What I want to show a little bit is our institute, Indian Institute of Public Health, is a public health university, offers master's programs in public health and hospital management, as well as postgraduate diploma in public health management for government medical officers. We work in many areas of public health, including environmental and occupational health. And this part of work includes the heat-related work. As Abhyant told you a little bit of the history, the major work in heat wave related mortality and morbidity started after the heat wave in Chicago in 1995. Chicago is a very cold place in America. Between July 11th and 27th, there was a big heat wave in Chicago, which is the green line. It is in Fahrenheit. The temperature went above 105 around Fahrenheit, degrees Fahrenheit. The mortality, which is the red line below, that has increased substantially. If you see the baseline mortality or death, number of deaths daily, in Chicago are like 170 deaths. The orange line is the normal death. But starting after the 11th of July, it suddenly went from 170 to almost 500 deaths in a day and went down. And total number of excess deaths were about 700 deaths in 1 week. And this woke up the whole of the US as well as many countries and the world, saying heat waves can really kill many people. This is a picture, Abhiyan showed you pictures from Ahmedabad hospitals. This is the scene of a Chicago hospital during the heat wave. Normally, in most of the emergency rooms are not so crowded in Western countries, but you see patients are next to each other and all old people crowding in various Chicago hospitals. Not only that, there were many old people who died whose relatives could not be traced and they were buried in mass graves. So this is a mass grave picture of Chicago where this priest is making the last prayer for so many dead people whose relatives could not be even found during the immediately following the heat wave. So starting with this background, another major heat wave hit Europe in 2003. And this also shows similar graph of increase in mortality, excess mortality, which is normal is counted as 0 because that is the average mortality for that year and month. But if you see, Europe had almost 70,000 excess deaths in a 3-week heat wave during 2003. And that again woke up the whole world to focus on heat-related mortality. And this is the heat wave in Europe and its increase in mortality, especially if you recognize the map of Europe. The central part of France and parts of Spain and Portugal were badly hit, and France had increase in mortality of almost 2,200 per day towards the end of the heat wave. I don't have time, so I'll not explain you in this in detail, but we can discuss later on. If you look at the Ahmedabad temperature, and Abhyant also showed you the Gujarat temperature, Ahmedabad temperature also has been gradually increasing. And those of you who live in Ahmedabad or any city and lived over 30-40 years, you will remember that in the 60s and 70s, the temperatures were not so hot and the winters were quite cold, but that has now changed. Winters have become very mild and summers have become very hot. So with that, let us come to the Ahmedabad heat wave of 2010. In 2010, in many countries, including India and Russia, had major heat waves. And Ahmedabad, where the normal summer temperature is between 40 to 43 degrees temperature, which is the black line below, in the month of May, in 2010, you see the maximum temperature reaching 44 degrees around 13th and 15th of May, and then suddenly jumping to almost 47 degrees on 21st of May, the top part of the red line where I have circled. So that was the major heat wave in recent times. Now, this is the meteorology or Vedashala weather service temperatures. So what we did, and each one of you should do in your own cities, is to correlate such heat waves with all-cause mortality. Ahmedabad and each other major cities have good birth and death registration. So every day, the total number of deaths, bodies which come to the crematorium or the burial grounds are totaled up, and the municipal corporation monitors that on daily basis. And you will see that during the month of May, Ahmedabad normally has about 100 deaths, which is the orange filled area, daily average deaths. On the left-hand side is the axis. But on 21st of May, the mortality suddenly increased and it went up to 310 deaths. So as compared to 100 deaths, we registered 310 deaths just in one day in Ahmedabad. And then There was no other epidemic or any pandemic or anything which would explain why these deaths are happening. And after that, 21st, you see the gradually deaths go down and become normal on 27th to 29th of May. So within 1 week, Ahmedabad registered 800 additional deaths, exactly similar to Chicago. But the temperatures are much, much higher. So what it showed, and this analysis when we did, the municipal corporation also understood that in a city which is already very hot and people are used to heat, there are so many excess deaths are happening. They are not all stamped or not all because of heat, but are related to heat. And if you take the excess deaths in the month of May 2010, it was 1,344. So substantially higher deaths as compared to the regular deaths which happen in any summer month. We also looked at ambulance service data. And this is just one ambulance service data available by various causes. And this is the cause which is listed as unconsciousness. Person suddenly becomes unconscious. You see the data compared in May 2010 versus April, 1 month before and 1 month after June. So you see sudden peak. Normally there are 10 cases of unconsciousness, 10 to 15. They suddenly go up to 55 cases. So unconsciousness as a cause also showed up in the ambulance data. So not only mortality data, we also saw some morbidity data. To summarize, what happens in a heat wave is something like an iceberg. What you normally see and get reported as heat stroke deaths are tip of the iceberg, which is only about 10% of the total deaths. The 90% of the total deaths are really not seen because they happen in the comorbid and old people. And that is why they are not registered as heat stroke deaths. So with this understanding, we also plotted for almost 15 years data of the maximum temperature, which is the line on the horizontal axis, and the number of daily deaths in the vertical axis. And you will see that after 41 degrees, the deaths start increasing. They further increase after 43 degrees and further increase after 45 degrees. So looking at this curve, we decided to have 3 levels of thresholds. Yellow alert after 41 degrees, orange alert after 43 degrees, and red alert after 45 degrees. So this was first time that such thresholds were worked out based on local mortality data. Later, after 2013, we also analyzed in 2016 the minimum and maximum temperature and its relation to total mortality for that day. What this graph shows, little bit difficult to understand, is there are 2 variables being captured. One is the average daily deaths, which are on the y-axis or vertical axis, and on the horizontal axis, we have temperature data where maximum temperature and minimum temperature combinations are shown. So when the maximum temperature goes above the last on the right hand side graph, maximum temperature goes above 45 and minimum at night goes above 30 degrees, then you get the maximum mortality, which is 264 deaths in a day. But if the maximum is more than 45, but the minimum is between 28 and 30 degrees, so nights are cool and daytime is high, then mortality is restricted to 138 degrees. And if the night is quite cool, which is below 28 degrees, then the mortality is hardly different. It is only 108. So what it shows is that not only the daytime maximum is important, but nighttime high temperatures are also important for causing deaths at night, deaths during the heat wave. I'm not going to talk. This is just picture of urban heat island effect. There is a whole presentation on that. Urban areas have much more heat than rural areas. Based on all this analysis, with the help of NRDC and other partners, the municipal corporation and IIPH jointly developed the heat action plan, the first heat action plan in 2013. It had 5 key interventions: awareness and publicity of the danger of heat and how to protect, so public awareness; capacity building of the medical systems or hospitals, doctors, health workers, ambulances; reducing heat exposure and adaptive measures; early warning system and interagency response plan; and monitoring of the impact of the heat action plan on the health. We will go into details of each one. First is, we conducted with the corporation and many other NGOs a lot of workshops and meetings, making people aware, and prepared a lot of publicity material on how heat kills, what to do during heat waves, how to recognize heat waves, and do's and don'ts during the heat season. This is some of the pictures. Now we see people protecting themselves in this way in recent times. Then we also did training workshops like the current one we are doing in Ahmedabad Municipal Corporation with the health department staff. The chief medical officer, the deputy health officers, the medical officers of the urban health centers and the medical colleges came together to understand how heat waves kill people, what are the clinical symptoms, signs, and levels of heat wave related health problems, and how to treat them. Then hospitals were also readied, because as Abhiyan showed this film, many hospitals were not really ready to receive heat emergencies in 2010. So they prepared cooling wards, cooling ice packs were kept ready, doctors and nurses were oriented, IV fluid and other medicines were procured before the heat season. Health workers in the community were trained and to educate the community, and urban health centers of the government were also ready for heat wave. And now you will even hear that private hospitals are preparing heat wards and announcing on local radios that we have heat emergency preparedness. So if you develop heat wave, come to our hospital. Then adaptive measures. So we have to reduce heat exposure. So keeping public parks open in the afternoon so that people can cool, distribution and setting up of pyau or water points for cold water on the street. Ahmedabad normally sets up about 700 to 1,000 places where free water is distributed through various NGOs and religious organizations, and many other measures. In 2016 onward, the heat action plan included cool roofing, which is the roof to protect from heat, reflective roofs, so that the heat coming in the building reduces and it protects people within the buildings. This is the early warning system which was developed earlier with the Georgia Tech University in USA, and later on 2016 onwards with IMD, which is the weather service or Vedashala department of the government of India. They send 5-day advance prediction of how much the temperature will go and what level of alert should be declared. This information goes to the nodal officer of the Ahmedabad Municipal Corporation, and that person then announces the level of alert as well as informs various government departments, media people, and various actions which need to be taken by different people, including hospitals, labor department, water, power utility, transportation, religious organizations, school board, zoos and parks, etc. So this whole plan, if you read on the internet, it is there. You will see what action plans need to be taken. And now NCDC has their own guidance for national health planning. Finally, we assess what is the impact, because many times in India, what happens is we take action, we plan, we do everything, but we don't assess. So we don't know whether our plan has worked or not. So we assessed the plan, its impact on health and mortality every summer when it is over in June, July, August months. So reduction in all-cause mortality and heat stroke cases and deaths. So this is a graph from pre and post HAP years, 2009 to 12, which is pre-HAP, which is the red line, and 2013 to 16, which is post after the heat action plan, which is the black line. And on the vertical axis is the relative risk of mortality. So you see that the red line has bent down after the heat action plan. The relative risk of mortality or the risk of mortality has gone down as the heat temperatures are increasing. So this was our first indication that the heat action plan is working. This is another. Ahmedabad Municipal Corporation has set up 5 centers where they monitor the heat stroke cases and heat stroke death. And you see the 2010 graph is much higher, which is before the heat action plan, as compared to 2014, 15, 16, which is much smaller number of cases reported and number of deaths reported. We also made a statistical calculation using some sophisticated analysis to see how many deaths are prevented in different warning levels, yellow, orange, and red warning levels. And total, we came to the conclusion that almost 1100 or 1200 deaths are prevented each year because of the heat action plan in Ahmedabad. And this paper is also published. With the help of IMD and NDMA, we jointly work together for about 100 cities, the various temperature thresholds, because if you know the temperature thresholds, then you can make better heat action plans. Given our work and its impact, the NDMA started developing workshops like this one, which is done by NCDC. Similar workshops were held with various disaster management authorities to replicate this plan in many, many cities. And now over 350 cities have such forecasting and plans in 23 states of India. We also got recognition that heat is a natural disaster. After our work, earlier it was not recognized as a natural disaster. Only floods, cyclones, etc., earthquakes were natural disasters recognized. But after our work and showing that so many people are dying, the NDMA also recognized as a natural disaster. And the then Health Minister, Shri Dr. Saab, I forget the name, but he announced, because what happened is Ahmedabad, after Gujarat heat wave, there are major heat waves in Europe and major heat waves in Bihar and UP. And he said that similar heat action plans, Dr. Harshvardhan announced that major such heat action plans should be implemented in UP and Bihar and whole of India. And that is how it got further boost from the health department. This work in 2018 earned the municipal corporation and our institute and NRDC and other partners the Earthquare Award as a recognition of the work done to prevent climate-related disasters. We have also developed with NRDC City Resilience Toolkit, and similar things, materials are also developed by NCDC now for national use. The key lessons I want to end with this is involvement of the local city authorities, the district administration, the health and political leadership. NRDC insisted that each time we launch a plan, we should get the mayor or the commissioner of the city to understand and launch the plan. So that ensures political and administrative leadership engagement. Then we engage with all stakeholders, including IMD for weather data, health department for mortality and morbidity data, city government for various actions. Then analysis of local mortality and morbidity data and correlation with temperature data. We always hear about the temperature data, but nobody, even in the cities like Delhi, Bombay, Chennai, Patna, Lucknow, we never hear what is the gross mortality on daily basis. So we don't know what is the impact. We say it is very hot, but are people dying? And it is very easy to tabulate daily mortality, because in any city there are not more than 30 to 50 crematoriums or burial grounds. So it is just adding 30 numbers at the end of every day will tell you how many people died yesterday, and that we can correlate with the temperature. Then facilitation by local and national institutes and experts. Many times what happens is in smaller and bigger even municipal corporations, people don't have capacity or are very busy in the health department. So it is best to have local. There are many big cities, have big universities, big institutions. They can be involved in the statistical analysis so that you have a much better understanding of what is the impact of mortality and morbidity. Then learning and adapting whatever is done in other countries. We don't have to this is not something which are original to Ahmedabad. We learned from Chicago, we learned from California, we learned from Europe and many other countries, and WHO guidance, and develop this plan. Finally, we must measure the process of implementation and impact on mortality and morbidity. If we do that, then we will be able to assess whether our plans are being implemented, and if implemented, whether we are getting the reduction in morbidity and mortality. These are some of the useful references. I will leave the slides. Dr. Purvi can share with all of you, so you can later on read the material. These are some of the papers we publish. So I would also encourage that each city should document their work, try to publish, and that is why if you involve a university, local university, they will be very helpful in analysis and publication of paper of your work, which the whole world will come to know. These are other scientific articles. I'll not go into detail. I want to end by showing you just one slide of what is going to happen. These are the predictions of IPCC, which is the big intergovernmental body which has been tracking this climate change. And if you see the left-hand side top corner, it is B1 scenario. We are at that place, 2011 to 2030. And we will move on the left-hand side, right-hand side and bottom, depending upon how much carbon we are able to reduce. If we don't reduce, if we go as we are going, we will reach the right-hand side lower corner, which is the most red picture. And temperature, average temperature will go to 4 degrees higher. If we reduce the carbon emission, we will go to the right-hand side top picture by 2080, 2099. So within next 80 years, we will reach here, which is on an average 2 to 3 degree increase. So what I want to emphasize is what heat we are seeing is just the beginning of the climate change. So जैसे वो एक गीत में है, पार्टी तो अभी शुरू हुई है, वैसे हीट वेव्स तो अभी जस्ट शुरू हुई है, क्लाइमेट चेंज तो शुरू हुआ है. If we don't take action in the next 80 years, we will be really in a very bad health situation. So this is a warning signal, and that is why NCDC is doing this yeoman service to alert all the states, cities, talukas, and districts to start preparing for the scenario which is going to come. Even the best scenarios predict that we will have at least 2 to 2.5 degree average temperature rise. And average means the whole year average. So actually the maximum temperature may go up 10 degrees, 15 degrees, we don't know. Already you might have heard this year, the North Pole or South Pole temperatures were 40 degrees above what is the normal there. So you can imagine what's going to happen. So with that, let me thank and recognize all our partners. NRDC has been our solid partner since the beginning. CDKN, University of Washington, Mount Sinai School of Medicine, which are the foreign partners, Ahmedabad Municipal Corporation, IMD, and 108 Emergency Service, which are the local partners. So with that, thank you very much. And I'm sure you will learn from Ahmedabad and try to implement such things in your own places. Thank you.
Thank you, Dr. Maulankar, for that elaborate presentation. Before we move on, I want to suggest whoever has question, if you can please type in the chat or Q&A, we can answer that in the live session, or we can also type the answers. So you don't have to wait until the end of the session. So I would like to summarize before we move on. So we learned that if you are not prepared for heat, even the developed countries have faced problems with managing heat wave and related morbidity and mortality. Although yet in India, heat wave is not categorized as disaster, there are instances in globally where this year, first time a heat wave was categorized as a heat wave and named. So it was in the Spain where they named a heat wave Zoe. And so according to that, Spain was prepared and they prepared for managing the cases. So heat wave is called silent and invisible killer of silent and invisible people. Although we might not feel it is too much heat, but people are suffering. And one suggestion I have based on what we heard is many states still not they are not part of surveillance, or they might not be seeing a heat wave case or a heat stroke case. But what our experience suggests that if you look at the mortality, all-cause mortality in a place, maybe a district or state or city level, and just plot it with the maximum temperature and minimum temperature, that will help you to understand if the mortality increases with temperature. And that is the first very sensitive measure of understanding health impact of heat. Another thing that we learned is localized action and localized planning is very important, especially in the cities, because they are the hotspot of heat. They trap heat because of various reasons, various buildings and land use that they have. Many times they don't even cool down at night. So because of those continuous heat night and days, the exposure to heat for the people is much higher than in rural area. And so having an understanding of that impact and assessment that will give you triggers for when to act, what to act, and how to coordinate with other departments, that is really helpful to prepare and a localized action. And as you know, we have state action plans, district action plans, and we are also encouraging to have city-based action plans. So once you learn these common pillars and methodologies on how to identify and how to work out coordination aspects, it is not a very big challenge. I mean, it is doable for SNOs, DNOs, and that will help a health department to take center of all the activity, because ultimately the health that is suffering, not the economy. So you can look into this Ahmedabad action plan or action plan, and try to find your ways to make this work in your state and cities. So with that, I will again call Dr. Abhyan Tiwari. So he is the lead climate resilient and health consultant in NRDC. He was a part of team of Ahmedabad Action Plan, and he has extensively worked in this area, and also he has worked in GIDM, Gujarat Institute of Disaster Management, and various academia, governments, and non-profit organizations in terms of public health research, program, policy development, management, and evaluation. And he will take us through heat island effect, assessing heat thresholds, and establishing triggers. I hope that will be a very learning experience for all of you joining here. So to Dr. Tiwari again.
Thank you so much, Dr. Purvi, and I must thank my mentor, Dr. Dilip Maulankar sir, for that very enlightening session, which is also the work that we all did under his leadership, his and other partners' leadership, which kind of worked as a pioneer work in the area of extreme heat and health, not just in India, but also in South Asia itself. Dr. Puri, आपने मेरा थोड़ा सा ना इसमें एक क्वेश्चन लिख कर दिया, but let's see how good our participants are attending our sessions. So एक question जो मेरे पास last में है, you already answered that. Let's hope some of them captured it and will be able to answer it when I pop up the question. So with this, I'll be. Am I audible, Dr. Purvi?
Yes, yes, you are.
Okay, thank you. So with this, I'll be talking about the urban heat island very briefly at the end, but I'll majorly be talking about the importance of estimating thresholds, why they are important, what is the basic science or idea or understanding that goes behind it. So this gentleman, you see, he is thinking that this heat wave is making him as unproductive as any other typical work day. So if he's as unproductive as any other typical work day, then it may not be because of the heat wave. Because if it is heat wave, then it cannot be any other typical work day. So या तो इनको कोई false positive forecast मिला है, or he has some his own personal reasons behind it. And like what Dr. Maulankar said, कि अभी तो party शुरू हुई है. If you are thinking that you have already had the hottest summer of your life this year, then you are wrong. This is the hottest summer that you so far had in your life. So ये हमको बिल्कुल भी नहीं मानना चाहिए कि हम आने वाले समय में अब इससे कम गर्म साल या इससे कम गर्मी देखने वाले हैं. It's gonna be here. The heat is here and it's gonna be there. And unfortunately, we'll still see steady rise until and unless we take some really major corrective actions that are governments will have to take at the larger scale. But जितना warming हम कर चुके हैं उसका impact हमें देखना ही पड़ेगा. So we have to better prepare for it. I already said we'll be talking about the importance of thresholds, how they play a role in the heat health early warning system, and how heat health early warning systems or heat health warning systems are part of the larger heat action plans, which are a more comprehensive plan of which the early warning system or heat health warning systems are just part of it. And then what are the decision makers dilemma that goes behind in decision making, particularly on deciding the thresholds and triggers. If you remember, I shared, and if you still have access to that link, I would urge you to answer this poll also. If you don't have access to that link, I have shared again in the chat box. You can answer it now. So let us understand. Does your city or state has a functional heat action plan? क्या आप जिस state से हैं या जिस city से हैं या जिस district से हैं वहाँ पे already एक functional heat action plan है या नहीं है? I'm already running behind time, so we'll try to do it fast. तो मेरा आप सबसे आग्रह है कि आप जल्दी अपने responses दीजिए. जो यहाँ response नहीं दे पा रहे वो chat box में दे सकते हैं. और ये पोल आने वाले 4-5 साल तक चलता रहेगा until and unless NPCC is satisfied कि नहीं अब हमारे सारे states में we have at least the functional heat action plan for health related illnesses, at least, if not comprehensive. Okay, we only have 22 responses, whereas we have more than 180 participants. I don't know is a good answer to give if you don't know. All the master trainers, at least they should answer. All the the SNOs, at least they should answer this. Rather, they definitely must answer this poll. All right, so by and large, 40% of our responders thinks that they have heat action plan. Their state or city has a functional heat action plan, which means it's in use, it's in place. 20% think there is no heat action plan which is functional, and 20% don't know, and 40% again are answering that their state doesn't have a functional heat action plan. No worries, आगे बात करते हैं. So what is the heat health warning system in it? It's the broad purpose of heat health warning system, which is an integral part of the heat health action plan, is to provide a meteorological or a climate-based forecast information on the likelihood of the forthcoming hot weather that may have impact on the health or public health. सादी भाषा में बोलूं, एक ऐसा सिस्टम हो जहां पर आने वाले समय का टेम्परेचर क्या होगा या आने वाले समय में वेदर की कंडीशन क्या होगी और उसका हेल्थ के ऊपर या पब्लिक हेल्थ के ऊपर क्या इम्पैक्ट रहेगा, ये जानकारी किस माध्यम से आए, कहाँ से जानकारी आएगी, कहाँ जाएगी, और जो वेदर कंडीशन है, फॉर एग्जांपल हीट एक्शन प्लान में टेम्परेचर, अगर हीट हेल्थ अर्ली वार्निंग सिस्टम की बात करूं तो वो टेम्परेचर जो थ्रेशोल्ड है वो कट ऑफ क्या होगा, और वो कहाँ से इंफॉर्मेशन रिसीव होगी, और वो कहाँ पास ऑन करनी है, किन स्टेक होल्डर्स को, की स्टेक होल्डर्स को पास ऑन करनी है, ये पूरा जो सिस्टम बनता है अर्ली वार्निंग सिस्टम, वो एक इंटीग्रल पार्ट है हीट एक्शन प्लान का। जैसा मावलंकर सर ने भी बताया था, जो 4 इंपॉर्टेंट कंपोनेंट्स थे उसमें से सबसे इंपॉर्टेंट कंपोनेंट था द इंटर एजेंसी कोऑर्डिनेशन एंड अर्ली वार्निंग सिस्टम। तो आईएमडी के थ्रू हमारे नोडल ऑफिसर अहमदाबाद हीट एक्शन प्लान के जो हैं, उनको हर समर के जो मंथ्स हैं उसमें डेली 5 दिन का फोरकास्ट मिलता है, प्रोबेबिलिस्टिक के आने वाले 5 दिन में टेम्परेचर क्या होगा, एंड देन बेस्ड ऑन द टेम्परेचर थ्रेशोल्ड्स जो कैटेगरीज डिसाइड की गई है, रेड, ऑरेंज एंड येलो, कि आने वाले 5 दिन में किस कैटेगरी का टेम्परेचर होगा, और उसके अकॉर्डिंगली हेल्थ पे क्या इम्पैक्ट हो सकती है, क्या डिसीजंस लेने चाहिए अलग अलग स्टेक होल्डर्स को। तो दिस इज डेफिनेटली एन इंटीग्रल एंड मोस्ट इंपॉर्टेंट पार्ट ऑफ द हीट एक्शन प्लान. But let us talk about what are the options and best in use methods for estimating thresholds for heat health warning system. Before heading to that, let us also understand what is heat stress. It's a situation where too much of heat is absorbed by a person. Heat as in the environmental heat, not the industrial or work related heat. So when the too much of heat is absorbed by a person, it is that situation which causes heat stress. Now, what is that too much of environmental heat? Is that too much of environmental heat is what we call heat wave. In general, एक simple understanding अगर मैं बोलूँ heat wave क्या है या extreme heat conditions क्या हैं, तो वो है एक prolonged period of abnormally hot weather. Right? There is no universal definition. There is no universal cutoff or threshold for heat, for triggering heat. Extreme heat or heat wave early warning system. It's a local phenomena. There is no universal definition for it. अगर आप उसी पोल पे हैं तो आपके पास ये क्वेश्चन आया होगा। आप सब अलग अलग स्टेट से आए हैं, मैं समझ सकता हूँ। मेरे पहले पोल में जब आपने आंसर किया था, कैन यू टेल मी एट व्हाट टेम्परेचर डू यू स्टार्ट फीलिंग वेरी हॉट? कि नहीं भैया, इसके ऊपर जब जाता है देन आई स्टार्ट फीलिंग वेरी हॉट। Do you feel very hot during summer after 35 degrees Celsius or after 40 or 45? Very hot. Not just hot, very hot. बहुत गर्मी लग रही है। So I'm sure आप लोग ये वेरिएशन जब आप आंसर कर रहे हैं तो आप भी देख पा रहे होंगे कि how all of us coming from the same country have different personal thresholds, I should say. हम सबको अलग अलग एक ही समर के सीजन में अलग अलग टेम्परेचर पे बहुत गर्म फील होता है। अब we feel very hot at different temperatures. Possible है because our bodies are acclimatized to the environment, to the climate that we are inhabitant to. जहाँ हम रहते हैं वहाँ के climate से हम acclimatized हैं. That doesn't mean that particular place, if it falls in a cooler climate, cannot have heat wave. Like Dr. Mavlankar sir already mentioned, even in this year, North Poles had heat waves where the temperature went 50 degrees above the normal average temperature of that particular period for the North Poles. So even in poles we can have heat wave. इसका ये मतलब नहीं है कि वहाँ 50 डिग्री सेल्सियस टेम्परेचर चला गया था, बट जो नॉर्मल टेम्परेचर जितना भी माइनस में होना चाहिए नॉर्थ पोल पे उस समय, इस समर में, उससे वो 50 डिग्री से भी ज्यादा था. It was still in minus, but it was more than 50 degrees above the average normal temperature that should have been there on the poles. So same applies for the place that we are living in. If I am living in a region like hot and arid region, for example Gujarat में, for example Ahmedabad में 45 degree पे हम लोग red alert issue करते हैं. Above 40 we generally don't feel very hot in summers because almost our entire summer, particularly April and May month, they are almost above 40 degrees Celsius throughout this summer. So what I was trying to tell you all in my previous slide is that a heat wave is a local phenomena. There are no universal cutoffs or thresholds for heat wave. It's a local phenomena, right? फॉर एग्जाम्पल यूरोप में जब 2003 में हीट वेव आया था जिसमें 70,000 से ज्यादा लोगों की जान गई थी, इंक्लूडिंग मोर देन 18,000 पीपल डाइड इन फ्रांस अलोन. The temperatures were hovering around 37 to 42 degrees Celsius in the entire Europe. उससे ज़्यादा temperature वहाँ नहीं गया था, but even that temperature took a toll of more than 70,000 people in Europe. Whereas in India, our definition starts with 40 degrees Celsius in plains. Our definitions for heat wave by the India Meteorology Department, it starts after 40 degrees Celsius. 40 degrees Celsius से ऊपर जब तक नहीं जाता तब तक plains में यानी मैदानी इलाकों में हम लोग heat wave declare भी नहीं करते हैं. So why it is necessary to estimate the thresholds? Because there is no universal definition. It's a spatial phenomena. It could be regional, it could be sub-regional, it could be local phenomena. It's also a temporal phenomena. 48 degree or 50 degrees Celsius for one day could be very dangerous. Even one day could be very dangerous as compared to having 40 degrees Celsius for throughout the summer for a hot area. Or even for example जो अहमदाबाद में हुआ था 2010 में टेम्परेचर 45-46 डिग्री से ऊपर काफी दिनों तक रहा था, almost 2-3-5 days, an entire week was above 43 and there were consecutive days above 45 and 46 degree Celsius when the city remained blistering during summer. And so duration is also an important factor in estimating the thresholds, and there is no one size fit for all. So local thresholds are essential for effective heat health early warning system is what I'm trying to emphasize here. इसी साल की बात करूं मैं, अगर ये मैंने एक वेदर फोरकास्ट का स्क्रीनशॉट था. If you can see, चंडीगढ़ में at 40 degrees Celsius there was heat wave. कोलकाता at 41 degrees Celsius there was heat wave. Delhi 42 पे it wasn't heat wave. Lucknow 43 पे it wasn't heat wave. Ahmedabad 43 it wasn't heat wave. Why? It could be because of the duration criteria that I just explained, because it is also the duration that IMD considers while declaring a heat wave in India. So what is threshold for heat? क्या होगा threshold? कौन सा variable होगा? एक meteorological variable at which the risk of adverse health outcome increases substantially. What could be that thermal variable? It could be Tmax, which is a maximum temperature बोलते हैं, जो कि most widely used थर्मल वेरिएबल है अक्रॉस द ग्लोब. टी मिनिमम यानी मिनिमम टेम्परेचर, रोज का जो मिनिमम टेम्परेचर गया है वो. टी मीन एक एवरेज डेली का टेम्परेचर. ह्यूमिडिटी इंडेक्स और इस तरह के कई कॉम्प्लेक्स वेरिएबल्स हैं मेट्रोलॉजिकल. हाउ टू एस्टिमेट हीट थ्रेशोल्ड्स फॉर हीट हेल्थ इम्पैक्ट? मावलंकर सर ने ऑलरेडी शेयर किया कि हम लोगों ने एनडीएमए के साथ एक स्टडी किया था वेयर वी एस्टिमेटेड थ्रेशोल्ड्स फॉर मोर देन 100 cities of India, and I understand that NPCC has also shared it with the states for the districts and cities to utilize those findings if their city or states are covered in that study. So it could be done epidemiological by the epidemiological study methods or by percentile based. What are the epidemiological methods used? Time series analysis सबसे ज़्यादा frequently used होता है. कौन कर सकता है? एक बायोस्टैटिस्टिशियन कर सकता है, एपिडेमियोलॉजिस्ट कर सकता है. सर ने जैसा अभी बात की कि पब्लिक हेल्थ इंस्टीट्यूशंस हैं, स्टेट मेडिकल कॉलेज, डिस्ट्रिक्ट मेडिकल कॉलेज, दे शुड बी इन्वॉल्व्ड इन मेकिंग द हीट एक्शन प्लान्स, and any other domain expert or institute, for example NRDC, which has interest on working on the same area of interest. Percentile based, it is even recommended by the WHO, WMO, that in situations where we don't have the outcome data or the health data available, but we have the meteorological data available, in that situation, even the 90th and 95th percentile could be a good, contemplated to be used as a warning trigger value for heat early warning systems or heat health warning systems. Who can do this percentile based? In fact, IMD is already doing this and has already done it for several cities and districts in India. Other things to be considered, हम लोग maximum temperature की तो बात करते हैं, but this is one of the recent studies that we did, where even the minimum temperature after a certain threshold value during summers can have larger impact on public health compared to maximum. Vulnerabilities की अगर हम बात करें, we should also consider vulnerabilities by estimating our triggers or thresholds. because it's not universal that everyone will be affected the same way by the same weather conditions or temperatures. Women by and large are affected more. People at extremes of age, like the younger children and the elderly, are affected more. People living in dense slum areas are affected more as compared to those who are well off and living in a, in the posh areas of the town. What should be the statutory unit for threshold estimation? At what level it should be done? It should be done at a city level, at a district level, or at a village level. It should at least be done at a city level or a administrative boundary where the population is at least more than 1 million, or at a district level. There should be operational units of heat action plan development and implementation. Ambient temperature doesn't vary much geographically within the district unless major differences in the contour or weather systems. Thresholds estimate करते समय जो decision makers हैं उनके लिए कुछ dilemmas हैं which we should consider here. Most importantly, कौन सी method use करनी है, simple या जो epidemiological method मैंने अभी बताई simple हैं वो use करनी है, और there are even more complex biometeorological ones which at present in India we don't consider. Which thermal variable is to be used, whether T max to be used for early warning, minimum temperature use करना है, mean use करना है, again maximum सबसे ज़्यादा use होता है T max या maximum temperature. एक इश्यू हमेशा रहता है reliability of forecast, के जो forecast हमें receive हो रहे हैं whether they are reliable or not. Good news is that IMD, the India Meteorology Department, जो हमारे देश का प्रमुख हवामान का विभाग है, उसने उनकी जो forecasting skills हैं over a period they have improved tremendously, including the forecast of day 3 to day 5. So जो हमें पहले probability of detection हुआ करती थी in day 3 to day 5 forecast has improved more than 80%. Improved very significantly, whereas the accuracy of warning in terms of probability of detection is more than 80% for day 1 and day 2 for almost past a decade now. What else is the decision makers dilemma? Outcome data क्या use करना है for estimating the threshold or doing the analysis to assess the impact, whether all cause mortality is to be used, cause specific daily mortality is to be used, hospital daily admission count use करने हैं, emergency ambulance calls के data use करने हैं. All cause mortality जो है daily mortality वो most widely used variable है, सबसे ज़्यादा यही variable use किया गया है across the globe. All cause daily mortality. Again, if you are on the same slide, let me put you in the decision makers dilemma. On your left, वो लिखा है accumulated excess mortality, but जो left वाला figure है, that's actually daily excess mortality है. And on your right is the cumulated excess mortality graphs. So where do you want as a decision maker to set your thresholds for heat health early warning or heat health warning system for your heat action plan of your state or your district? Would you want to put it on T1 or temperature 1 or temperature 2 or temperature 3, looking at these two graphs? So you can enter your response now. Hello?
Yeah, we can hear you.
Yeah. मैं फिर से बोलूं, जो लेफ्ट साइड में ग्राफ है वो डेली एक्सेस डेथ्स का ग्राफ है, और राइट में जो है वो क्यूमुलेटेड एक्सेस डेथ्स का ग्राफ है, मतलब काउंटिंग अप टुगेदर. सो इन दोनों ग्राफ को देखते हुए आप T1 टेम्परेचर 1 पे थ्रेशोल्ड एक्सेस डेथ्स ड्यू टू एक्सट्रीम हीट वीकेंड से आप T1 पे एस्टिमेट करना चाहेंगे, T2 पे रखना चाहेंगे या T3 पे रखना चाहेंगे? Remember, there is no right or wrong answer here. It is just I'm trying to put you in the decision makers, position. कि आप अगर estimate, for example, Ahmedabad में red alert is at 45 degrees Celsius. Why it cannot be 43 or why it cannot be 47? So what goes behind making that decision? We are expecting more response to this question. अभी सिर्फ कुछ लोगों ने ही response किया है. People are also answering in the chat. No worries. There, as I mentioned, there is no right or wrong answer to this. But by and large, people have voted 42 कि वो एक ऐसे टेम्परेचर पे थ्रेशोल्ड सेट करना चाहेंगे जो ना कि बहुत ज्यादा कंजर्वेटिव है और ना कि बहुत ज्यादा रिस्की है. So good. This could be a good threshold, but there is always right or wrong answer. There is no perfect answer. Now let's take decision once again. We took this decision on the basis of excess mortality. How about if we have to take the decision based on this? Where would you as a decision maker set the threshold now? So as you see now, we have two different trend lines. One is of mortality and one is of morbidity, heat related morbidity. So heat related morbidity start at much lesser temperature than the all cause mortality, the temperature threshold value at what we see the impact on mortality starting. But remember, all those morbidities are ending up to our health system and putting burden to our system, our health system, and putting cost to our health system and people as well. So if now you have to be conservative or risk savvy or risky in your decision making, where would you set your threshold? So now it's situation, the situation has turned in a complete different way. More people are now bending towards T1 as compared to the previous decisions that our participants make on the previous slide. Again, there is no right or wrong answer on this. So let's take a global look what is happening at the global level. The good part is that spending per capita on the adaptation towards climate change, impact of climate change for health has increased substantially over past several years. But the unfortunate part is that the spending has increased more in the high and very high human development index countries as compared to the low and medium human development index countries, which are affected more by the impacts of climate change and including extreme heat. So climate, if I show you these two graphs, these two maps rather are of high climate vulnerability, maps of high climate vulnerability and lower universal health coverage index. So what you can clearly see is the country with higher universal health coverage index has lower climate vulnerability, or otherwise if I say the countries with higher climate vulnerability, for example, including Africa and South Asia, has lower universal health index. Universal health index, we all know, talks about access and quality and affordable healthcare to all. And climate change, including extreme heat, are a barrier to that as well. How the rising temperatures don't just put burden on the public health, on the people, but also puts burden on the health workforce and causes disruption and impairment of our health services as well, which indirectly also affects the accessibility, quality and affordability of healthcare that we envisage under universal health coverage. Urban heat island, Dr. Purvi already briefly mentioned about it, and Dr. Mavlankar also mentioned about it, that it's the phenomena where we see an average higher temperatures in our urban areas as compared to the peripheral rural areas or peri-urban areas. This is largely because of the the type of infrastructure, the type of land use that we have in our urban settings, which are not allowing, the heat to be mitigated as it has, it happens in the natural environment with higher vegetations in the rural areas, for example. And why this is a concern? Because the entire world is urbanizing at a rapid scale. India itself will be, 2/3 of India will be living in urban areas by the end of 2030. So this again becomes a major concern for us, because urban heat island is again, enhancing or increasing the risk of extreme heat to the people, to public health and their livelihoods. But good part is that the world has also started identifying this as a major concern and has started working on addressing the urban heat resilience, not by just managing the heat, extreme heat in the urban areas, for example, with adaptation plans like the heat action plans, which focuses on emergency preparedness, public health, and public health response, ensuring reduction in the personal exposure, and ensuring the energy supply, but also working on the long-term heat mitigation measures, like working on the land use, working on the urban designing and urban greening, and also addressing the issue of waste heat. Cities are coming up with the chief heat officers. Dr. Purvi also mentioned about the civil, which is a country, which is a city in the Spain that has came up with a chief heat officer. But not just that, there are many other countries and cities that are coming up with the chief heat officers, who are solely responsible for addressing the issues of extreme heat in their areas. We are talking about deploying heat officers and policies and matrices in place to advance the heat equity and to mitigate and manage the risks of extreme heat, and to coordinate the initiatives that are not just directly working on public health, but also also covering the other sectors that has indirect impact on health or livelihood of people that can get affected by extreme heat. For example, this year, when we had record heat wave, we might not have seen the direct impact on public health in the extreme, hot weather conditions of 2022 in India, but we definitely saw the indirect impact on other sectors. For example, agriculture, for example, power sector. So these are the sectors which are essential to ensure, even for example, power sector and transport sectors, they are essential to ensure that we have, there are no disruptions in our health services or supply, and that sectors also need to be addressed in the times to come. So the issue is getting larger than just a concern of public health now, but the public health will always remain key.
I think we lost Dr. Abhiyant. Okay, so I think we can, in interest of time, we will move forward with our next expert. Next talk is about implementation of heat action plan, SOPs, and surveillance of heat-related illnesses. And for that, we will have Professor Dr. Mahavir Golecha talking about it. And he also has some exercises. I will put a link to those exercises and you can download it and work out after the session, or if you have a question right away, you can ask about it. So over to Dr. Mahavir.
Yeah. Thank you very much, Dr. Purvi. Hope my voice is audible and slides are visible.
Yeah, if you can, come a little closer to mic. The voice
Yeah,
is
I'm very much closer. I think some
your voice
issue.
is really faint.
Yeah, so
Okay.
thank you very much. So thanks to Dr. Abhyant for excellent presentation. He has explained very nicely the concept of early warning system and determining the threshold, which is the one of the important component of the heat action plan. And he also talked about the urban heat island that is very important for phenomena most of the city or nodal officers should understand. So I will now talk about basically implementation of heat action plan, how we should implement the heat action plan, various building block of the heat action plan, also various standard operating procedures, the document which will be shared with you by NCDC, and also various format for monitoring and evaluation and surveillance. So to begin with, so basically what is a heat action plan? So as Professor Mavlankar told, and also Dr. Abhyant also mentioned, that basically heat action plan एक framework है और guideline है. So it is a guideline about that what action and what activities, what strategies you need to implement for prevention and management of heat related illnesses in your state, your district and your cities. So you can prevent your population from negative impact of extreme heat on their health. So basically एक पूरा फ्रेमवर्क होता है, उसमें पूरी एक्टिविटीज है, एक्शन है कि अलग अलग डिपार्टमेंट को क्या क्या एक्शंस लेनी है एंड कब कब लेनी है. एंड जो प्राइमरी ऑब्जेक्टिव होता है इज ऑफ दिस हीट एक्शन प्लान इज बेसिकली because there are two types of actions we are intended to implement in heat action plan. One are for short term measures and second types are long term measures. So in short term measure सबसे first action होती है कि we have to inform or we have to alert the population about that there would be a heat wave, there would be a red alert day or there would be a orange alert day. So they can take preventive action, they can build their resilience, they can increase their, enhance their adaptive capacity, so they can prevent themselves from heat related illnesses, or they can take the appropriate precautions. Then one of the important component of heat action plan is preventive management. So what is happening in implementation of heat action plan? That one is that system is taking preventive precautions. So they will arrange appropriate resources like ORS or cool water or cold packs, or hospitals would be ready with heat illness ward, or administration will ensure that additional water point, or they will take additional actions for vulnerable groups. So basically to prepare administrative department to take preventive action for preventing population from negative impact of extreme heat. And all city authorities or district authorities and citizens can learn how to deal with heat wave in their specific town and city, thus reducing the negative impact of extreme heat events. So as Professor Mavlankar has already discussed, just to recap, we can divide key strategies of implementing heat action plan in 5 different headings. First is building public awareness and community outreach. So one of the important building block and action of heat action plan is basically we have to create awareness among public and to reach to the vulnerable community, especially vulnerable community. So we can inform them about the risk of heat wave. So what action they should take during heat wave days, and when heat wave is coming, when there would be a red alert. So we have to basically building public awareness. Second is utilizing an early warning system and interagency coordination. So Dr. Abhyant has already told about the early warning system. So we have to coordinate and collaborate with the local IMD. So in every airport area near there is a IMD office. So you can collaborate or coordinate with them. So they will give you the forecast, like next 5 days, what would be the temperature, whether it is going to cross 43 degree, 45 degree. And based on that and all-cause mortality data, you can develop threshold for your own district, for your own cities. Based on that threshold, you can basically issue an alert. So if it is IMD will give you the temperature. Okay, so if it is 45 degree and for 45 degree temperature is red alert for your city, so you will issue an early warning that okay, next 3 days there would be a red alert in our city. So accordingly, each and every line department will take appropriate action. Third component of or building block of heat action plan is capacity building among healthcare professionals. So you have to build capacity of medical officer, we have to build capacity of public health officer, healthcare worker, ASHA worker, nursing professional, and also the line department officer, like we are doing this the TOT of trainer. So it is your responsibility. You will further you will have to do the training of healthcare worker. You have to do training of other line department, important stakeholder. Then final building block of heat action plan is basically promoting adaptive measure, so we can reduce the exposure to heat. So we have to carry out vulnerability assessment studies. We have to identify high risk area and high risk population. So special action can be taken for such population groups. So I have talked about early warning system and interagency coordination framework. So one of the important things we have to do, we have to basically develop a framework. Framework means we have to develop a system of governance that during heat wave season, what are actions each department has to take, and each department we have to identify a nodal person. So there would be a district nodal officer, and in each department one officer should be designated for as a nodal officer. So if you want to do any action to be done from electricity department, so there would be one nodal officer. Yeah, he could be a junior engineer or senior engineer depending upon the size of city. In water department we have to also identify it, so we can ensure that additional water point or additional water supply to a particular area when there would be red alert. So in transport department, so every line department we have to identify one nodal officer, and there would be a district nodal officer or a state nodal officer or a city nodal officer like we appointed in the city of Ahmedabad. And similarly in school department, in park department, we have to also collaborate with the civil society organizations, NGOs, because we will need their support because they are working in many vulnerable community areas. So this is basically a framework that how the heat action plan implementation work or happen. So first, early warning system, which we have to get it from IMD and local IMD. You can collaborate and you can coordinate with them. Then you have to implement the heat action plan. So there would be a state nodal officer or district nodal officer, which will take all the actions required for implementation of heat action plan. For example, additional supply of ORS, identifying the vulnerable areas, vulnerable group, ensuring power supply during red alert days, ensuring additional water supply during red alert days, then various mitigation measures. For example, some designated community hall for basically can be created as a cooling ward, more portable water point, change in school timing or changing work time of labor, animal shelters if animal lives are more in particular district. Then community awareness, public health awareness, issuing advisory, issuing alert to the media so they can basically publish in newspaper. So it will reach to population at large. Then long-term measures like we have discussed in the city of Ahmedabad, we have implemented cool roof technologies. So we have painted, we have put white paint, special thermo-resistant paint above the roof in slum areas. So the temperature reduced by 3 to 4 degree temperature within the house, creating more green areas. Like in Ahmedabad, the municipal corporation has developed oxygen park. They use landfill slide in converting, forest, urban forest. Then finally integrating climate change and health in school curriculum. After implementing in summer month, we have to implement all the actions of heat action plan in from March to July. From August onward, we have to review and monitoring what is the outcome of our actions. So the cycle will start from March to basically September. So there are 3 phases of basically heat action plan implementation. The first one is pre-heat season, which will from Jan to March. So we will prepare our heat action plan. We will identify the nodal person in each line department. We will basically carry out sensitization workshop with various stakeholders. Then during heat season, we have to take various actions, which I have mentioned in 5 building blocks, and we will discuss in detail in next few slides. उसके बाद हमें पोस्ट हीट सीजन में जो मैंने बताया कि हीट एक्शन प्लान का इवेल्यूएशन करना है कि जो भी हमने एक्शंस ली थी उसका क्या इम्पैक्ट हुआ, how many ORS we have distributed, how many additional water supplies we have done in vulnerable areas, how many cases we have identified timely, how many awareness sessions we have conducted in various areas. So all these actions would be documented in post heat season evaluation. So first and foremost action is appointment of nodal officer. So state nodal officer or district nodal officer should be appointed. He will be act as a chief district heat health officer. So he will be basically responsible for coordination with various line departments, because it is not only the nodal officer will take the action. Nodal officer will take the action with the help of all line department. There would be a focal person in each line department. So the nodal officer would be responsible for convening the meeting with key agencies. So as I already mentioned, during pre-heat season between January to March, we have to carry out 1 or 2 meetings with all line department that this year during heat we have to take following action, and each department would be responsible for carrying out. So each department would be given some terms of reference that, okay, water department, what action you have to do during heat season, electricity department, school department, labor department. So every department would be given some action to be taken during heat season. Then we have to create a list of high risk area, because in every city, in every district, there are some areas which are more vulnerable than other areas. For example, in Ahmedabad, we have identified 7-8 areas which are more vulnerable than other areas. In Rajkot, we did survey, vulnerability assessment survey, and we have identified more vulnerable area. They are more vulnerable to heat. So temperature is more in those areas than other part of the city. Then we have to engage state and local agencies to facilitate internal communication. We have to carry out training of basically healthcare worker, training of line department stakeholder. Even we can train school children that what precautions they have to take during basically heat season. Local community outreach actions should be carried out. Then we have to develop IC material. We can develop various posters. We can develop various IC banners. We can also develop some 60 to 90 second videos to communicate do's and don'ts during heat wave season, about who are more vulnerable, about first aid during heat illness, what are actions communities should take when they report any person with heat related illnesses. So we have to basically carry out all such activities. Then once one of the exercise during our NDMA workshop we did, because it is very important to identify which are the line department required for effective implementation of heat action plan, and within each line department you have to identify focal person, as I already mentioned. So one of the important line department is State Disaster Management Authority, SDMA, Health Department. Of course, most of the actions are related to the Health Department. Then we have Labor and Employment Department. So they will ensure that during the red alert days, labor should not work during peak heat hours. There would be a availability of water to drink. They should take some precautions during red alert days. Road work department, housing and urban affairs, water, and so they are basically important line department, and there are some other key agencies are also. So we have to basically coordinate with them, and we have to engage them in implementing various actions related to heat action plan. Then, as I already mentioned, because for early warning system, we will require IMD support. Without IMD support, we will not be able to get the forecasted data and we will not be able to issue alerts. So we will have to coordinate with local meteorological department to obtain regular forecasted data. They basically provide 5 days temperature data in advance. So based on that, we can issue alert to the population in advance. Then one of the important activities, we have to identify the vulnerable group, because as I already mentioned, some people or some population groups are more vulnerable than others. For example, elderly are more vulnerable because their respiratory and cardiovascular systems are compromised. Children, they are immunocompromised, their organs are developing. Pregnant women, because due to some changes in their basically physiology, so they are more vulnerable. Chronic ill patient, homeless, because they don't have roof, they don't have facilities for cooling, shelter, they don't have outdoor workers, etc. So they are more vulnerable. So we have to identify vulnerable group as well as vulnerable area with the help of satellite data. So Landsat data are available. We can identify which areas of cities are more hotter than other areas. Then, as we know that our human resource capacity is limited, so we have to collaborate with NGOs and civil society organizations, so we can reach easily at-risk communities. We can, in Ahmedabad, we have collaborated with various religious group, NGOs. So they supported us with providing additional water supply to the vulnerable areas, implementing a new potable water point. Some community areas can be converted into the cooling space. So during peak heat hours, population can go there and they can rest for 2 to 3 hours. Then like we have shelters. So many cities you have seen during cold days, extreme cold days, there are rent baseras. So similarly, we can also have for heat. Then NGOs can also help us in community awareness and outreach activities. Door-to-door community awareness can be carried out with the help of NGOs. So I'll just talk about very briefly because in the interest of time. So in phase 1 pre-summer, few activities like conduct intersectoral meeting. As I already mentioned, we have to take on board all the line department, because it is all line department. They have to take their own actions for prevention and management of heat-related illnesses. IT department plays very important role, because they have to basically in area mapping, development of disaster and emergency management system, online reporting. Many activities can be done with the help of IT department. Health department, so it is health department who will basically treat, who will provide the treatment, and with the healthcare worker like ASA worker, we can carry out various public health and community outreach activities. Media and press office, after whenever nodal officer will issue red alert, so immediately they will inform all the newspaper, local FM, and also the electronic media. So they will basically, in Ahmedabad, whenever there is a red alert, in every newspaper there will be information that today is red alert. So public is now aware. So whenever red alert, they will take some precautions. Labor and other department, and community worker, education department. So child focus heat health training can be carried out in schools, and they can change timing of school if there is a red alert. Like instead of starting from 10 to 5, they can start 7 to 1 or 7 to 12. So depending upon the red type of alert. Then one of the important thing in the heat action plan, which you will also get in standard operating procedure, which will be shared with all the SNOs and DNO by the NCDC, we have to specify the role and responsibility of each line department. So they will basically, they will take their ownership that they have to do something during heat wave season. During phase 2, that is summer. So in summer, the nodal officer, of course, collaborate with, coordinate with the IMD, and they will issue the alert. They will activate the heat alert based on alert. Every agency, inter-department will take their own action. Then IT department will disseminate real-time information on temperature. Media and press office will release information in various social media platform, newspaper, Red FM, etc. So this is basically this has also been shown by Dr. Mavlankar that this is basically typical forecast which we got from IMD. So they provide us temperature forecast for next 5 days. So whenever it would be red alert, we immediately issue the alert to all line departments. And this is the system of alert for Nagpur city we have developed. So in Nagpur, it is not 45 degree, it is 46 degree red alert, and been intimated when temperature goes beyond 46 degree. So phase 3 is post summer. So in post summers, each nodal officer, state nodal officer, and district nodal officer has to basically evaluate the impact of various action implemented as part of heat action plan. So we have to basically document various activities being carried out. What is the impact of various training, how many ORS been supplied, how many NGOs provide the help, and then we can every year, if we will do the evaluation, then we will understand the impact of implementation of heat action plan in our city and district. So monitoring and evaluation is very essential, and NCDC is working since last few years, and they have also developed various format for basically reporting the data related to heat related illnesses from health facility to the district, and from district to the state, and from state to the national level to the NCDC. So they have developed various format, and it is very important to basically carry out monitoring, evaluation, and surveillance, because it will allow us basically to formulate a specific strategic preventive action. Because once we learn that, okay, our district is affected with heat wave, in our district which particular block is affected more, so we can carry out various actions for that particular block. And we will also understand that whatever action, whatever activities we are implementing as part of heat action plan, there is an outcome. The number of heat related illnesses will reduce, or maybe reporting will increase. More number of people are aware, more number of NGOs and line department are on board. So monitoring and evaluation plays a very important role. So this is basically about the surveillance. So NCDC has developed various formats. So format first is basically for health facility. So reporting list of suspected heat stroke cases at health facilities. So they will report that to the basically district health authorities. So there is also a standard operating procedure for basically reporting such data. So it is available with NCDC. So you have to basically identify the suspected heat stroke case. So the suspected heat stroke case means if your mental status is alert, patient mental status is alerted, including disorientation, seizure, or maybe delirium with elevated core body temperature more than 104 degree Fahrenheit. It can be with or without sign of stroke, history of infection, or sign of medication overdose. So such data should be reported to the district health facility. It is basically first A. Then we have another format, first B, in which you have to basically report suspected heat stroke death and confirm cardiovascular disease death. So then you have to compile, and then in format 2, you have to submit data to the from health facility to the district daily number of suspected heat stroke cases and all cause deaths. This will again feed into all health facilities will report to the district. Then district has to compile in format 3A. So district will compile all the suspected heat stroke cases and all cause deaths in format 3A. Then there is a format 3B, which district will compile. Entire district data would be sent to the state. If your health facility or district is not reporting any, then you have to mention 0. So you have to report the data, whether you are having any heat stroke, suspected heat stroke case or death or nil. So you have to report nil or 0. So you have to mandatorily report to the, and there I think NCDC is also develop a online platform for reporting real-time data. So that would be shared with you from the NCDC side. So these are various resources. So I'll share with you. For implementing heat action plan and for basically early warning system, we need data, mortality or morbidity data that can be obtained from registrar of birth and death at every municipal corporation or district level, then hospital details. So these are all kind of data required. So we know heat is increasing. It will increase further as mentioned by Professor Mavlankar in slide of IPCC. Heat can kill, and hence we need to protect our communities, our population. All medical and stakeholder have to prepare a basically health-based heat action plan and implement it to reduce morbidity and mortality. The plan is not complicated. It is basically existing human resource can implement. It is very much feasible. It just we have to integrate it in within existing system. We have to take short-term measures and long-term measures in future, like cool roof, more green cover. We need active participation from all the professionals. So that are various publications for Indian Institute of Public Health, Gandhinagar in the heat health area. Thank you very much from all the partners.
Thank you, Dr. Mahavir, for that elaborate presentation on how to prepare and implement action plan and surveillance formats. So I think for the group exercise, we will do it after Mr. Polash's presentation, right?
Yeah. If you want now, then I can. It will take few minutes. It's up to you.
I think we will go later only. So before we move on, I think Dr. Abhyant is back again. I would like to ask him to finish his slides. I think there are a few more left.
Yes.
Dr. Abhyant?
Yes, Dr. Puri, thank you so much, and I'm so sorry to all the participants, to Dr. Mahavir and Dr. Yu, for the disturbance that happened for poor connectivity. So I was almost actually done, but I also wanted to, since I initially announced that I'll check कि आपने जो एक question leak कर दिया था उसका answer कितने लोगों को याद है. So I'll quickly go to the final slides that I was on. You see the slides, right? Okay. So I already talked about these things that now the cities are across the world are moving towards deploying heat officers and policies and matrices. It's not merely limited to the health departments and having a heat action plan only, which is focused largely on responding to the health emergencies, but from responding to the health emergencies, we are now moving towards managing the risks and having coordinated initiatives and building higher heat institutions which can not just work on managing the impacts of extreme heat, but also work on mitigating the impacts of extreme heat in the times to come. For example, it has also moved from guidelines and plans to laws and policies. This example is from United States, where one of the states also came up with legislation to combat the health risks of extreme heat, and has introduced a legislation for that, and also provided $100 million budget in fighting the heat, the financial assistance of $100 million in the US. So these were the questions actually I wanted to ask. I believe these are some of the last slides that I have. If you are able to access the link again, ये question आप लोगों की slide पे आया होगा. Name the last cyclone you remember. लास्ट साइक्लोन जो भी आया हो, जो आपके दिमाग में हो, जो भी याद हो, जरूरी नहीं जो लास्ट आया वही, बट जो आपको याद हो, जिसका नाम याद हो. Okay, I see the responses in chat. But I don't see the response in the poll. Okay, Tote, yeah, we started getting the response. Great. Tote, yes, last year आया था. काफी बुलबुल, very good. Katrina, okay. निसर्गा, ओके. और कोई जरूरी नहीं है इंडिया का साइक्लोन, आपको यूएस का हरिकेन कोई याद है तो वो बता दीजिए, या टॉर्नेडो या और कुछ याद है तो उसका नाम बता दीजिए, बट विच एवर यू रिमेम्बर. अम्फन, गुड, अम्फन, ओके. जो हमारे ईस्टर्न स्टेट्स हैं उनमें से तो ज्यादा रिस्पॉन्स आना चाहिए इसके ऊपर. पार्टिसिपेंट्स फ्रॉम वेस्ट बंगाल, उड़ीसा खास करके, वो तो काफी साइक्लोन्स के नाम बता सकते हो, आई बिलीव. सो लास्ट 10 seconds to answer this question now. अम्फन सबसे ज्यादा आंसर किया गया है. All right, so now comes the last question. Name the last heat wave that you remember. Which was the last heat wave? Name, क्या नाम था उसका? What was the name of any last heat wave that you? आपने एम्फन बताया, एम्फन साइक्लोन है, तोते साइक्लोन है, निसर्गा साइक्लोन था. ऐसे ही हीट वेव भी बहुत सारे हुए हैं. Do we remember name of any heat wave? We remember their years, right? 2010 heat wave, 2015 heat wave, 2016 heat wave, 2003 European heat wave, 2022, very good. But I'm asking for name, not the year. And Dr. Purvi can answer this. Yes, Dr. Purvi. So it was the heat wave Joe, which was named by the Spanish city called Seville, which came up with the first heat wave naming and ranking and categorization criteria for heat wave, and they came up with this name heat wave Joe, which was the first heat wave named in the history so far, which again happened this year only. Although there is a lot of agreement and disagreement on this, whether heat waves should also be categorized, even if categorized named just like how we do in case of cyclones, because they both are totally different hazards and have different impacts, have different patterns, have different science behind it, and whether we should use the same methodology that we did for cyclones for the heat waves or not, what would be the benefits, or what could be the disadvantages of naming and categorizing heat wave just like how we do with cyclones, is still a dialogue that is under discussion among the scientists across the world. But the fact is that the first heat wave has already been named by not a global authority, for example, World Meteorology Organization or World Health Organization, but by the local administrations in this civil city in this Spain. So key takeaways from my side is we need to better communicate for a better change to the communities that we deal with, particularly the vulnerable communities that we deal with, particularly the key stakeholders that we deal with that has a take in addressing the risks of extreme heat in order to avoid the unmanageable and manage the unavoidable of extreme heat before it's too late. Yes, so with this I end my presentation. If there are any questions, I'm happy to answer that.
Thank you, Dr. Abhyant.
Thank you.
So I think we move on. We have a special Q&A session. So we go forward with the next presenter. So till this time, we had a discussion about the patient's like a human aspect of health heat impact, but additional heat, extreme heat also impacts on the health infrastructure and their function. As you know, under the program, we have different activities that we suggest in terms of health facility strengthening, which includes energy conservation, LED replacement, rainwater harvesting, solarization, and other different aspects of how to make a health facility resilient and function during the disaster like heat wave or floods or everything. So when we have a heat health action plan or heat health action plan, the health can not only inform how much the impact is, but it can also inform what actions can be done at the community and health facility level. So we have Mr. Polash Mukherjee. He will discuss about measures for health facility and community resilience to extreme heat, and some of the learnings we can use in our states and districts and help communities and our health facilities to implement this aspect. Mr. Polash Mukherjee is an environment, health, and air pollution management professional from NRDC, India. He has significant experience of working with national, subnational, and city-level governments and private organizations for research, project development, and implementation in developing economies. And he works in the area of air pollution, vehicular technology, clean fuels, emission reduction roadmaps, and climate change impacts. So over to Polash Mukherjee.
Thank you, Dr. Purvi. I hope I'm audible. Right. Thank you. The onset, let me take this opportunity to thank NCDC, Dr. Akash Srivastav, as well as all the participants of NPCCHH, the state nodal officers, and the trainers who are present here.
And Polash, can you come near to mic? Your voice is a little low.
Is this better?
Maybe.
Let me try without earphones. 1 second.
Okay.
How about now? Is this better?
Yes, better.
Right. Okay. Yes. Hi. So at the onset, let me thank NPCCHH and all the state nodal officers that have gathered here for this workshop. Also, I take this opportunity to acknowledge our long-standing partnership with IIPHG, which has been mentioned at several stages during this workshop. I have a slide deck, and I'll keep it short. I don't have a very long slide deck. Is it visible? Right.
Yes, visible.
Sure. Okay. So thank you for the introduction, Dr. Purvi. I think as like you introduced, my session is going to be about how healthcare facilities can strengthen their response to extreme heat in order to prepare them better to deliver the services that they are currently delivering, as well as to address the mortality and morbidity impacts of extreme heat. There is a difference here that is looking at the impacts and the mortality and morbidity impacts of extreme heat in the indoor context, given that we are looking at healthcare facilities. So that's what we will focus on today. I do know that I'm the second speaker from NRDC to speak in today's session, but I'll just give a quick introduction of NRDC. NRDC stands for Natural Resources Defense Council. It is a 50-year-old international organization that has more than 3 million members and online supporters. It has worked on various environmental issues since 1970. And outside of the US, it works in China, it works in India, in Canada, and Latin America as well. In India, we have been working since 2010 with local partners on areas including environmental health. And our longest standing body of work is the heat health work that Dr. Mavlankar mentioned, which began in the city of Ahmedabad, but has since grown beyond the city of Ahmedabad, and we work on several different cities and states right now. I've just included a screenshot of some of our key partner institutions and organizations here. Like I said, on heat health in India, we've been working since 2009-10. I think these have been mentioned by previous speakers. But both the NDMA and the NPCCHH under the NCDC are key nodal authorities and regulatory bodies that kind of govern heat health work in India, which has now grown from Ahmedabad to across 23 heat wave prone states that we have identified. This year, major wake up call year, and I'm expecting this figure of 23 to be updated for the coming year. And now my presentation is going to talk a lot about how we can increase the resilience of our health institutions, of our indoor spaces against extreme heat. And when we talk about these factors, I think cooling and energy efficiency is also a key factor that we should bring into the play here. Why is that? Is mainly because cooling and energy efficiency both represent a key area of change that we can bring into our economies going forward. The graph that you see in the center of your screen, this shows what our cooling demand will be in the year 2038. And this is an aggregated demand for all cooling that we see. And as you can see that the yellow component refers to space cooling, which means air conditioning, cooling of indoor spaces, cooling of your homes, your offices, your healthcare institutions, and so on. And that will account for a massive lion's share of the total cooling demand that we will have. This is why cooling remains a significant part here. Now, why is this being addressed at this forum? SNOs can have a significant role in creating the awareness of these interconnections at different levels, at the state level, at the district level, and definitely at the city level, like we have seen in many of the cities that we work in. To build this connection between these aspects, like we are hearing now a lot about climate change and about net zero targets that our Prime Minister has announced earlier this year. About what does that mean, and what does this have to do with extreme heat, with heat waves? So I hope to address some of these things of my presentation. Again, here we come to cooling demand. This is the potential of cooling demand in key cities. This is a projection that was made in 2009. So this may be outdated already. But as you can see, potential cooling demand in cities, in Indian cities, all the ones in red, Mumbai, Calcutta, Delhi, is much higher than the global counterparts, simply because of the potential of heat waves in India. Heat waves can be very severe, and also the growth aspects comes from the perspective where we talk about what the current state of access to cooling is in India. So a lot of people in India, including a lot of our institutions, definitely our healthcare facilities, don't currently have access to adequate cooling. So that is where the cooling is expected to come from, the fresh demand. Now, in this context, how does cool roof fit in? Now, what is cool roof? Cool roof is, I think some of you may have seen this earlier, but still just to demonstrate, this picture on your left here, it talks about the impact that the reflectivity of your roof surface has on the heating, indoor heating inside of a structure or a room. If the color of the roof is of a darker nature and the reflectivity is lower, it absorbs much more heat, and therefore the indoor temperature here can be much higher than in a roof where the reflectivity is higher, the lower color, the color is lighter, and therefore the indoor temperatures are relatively lower than what it would have been otherwise. So in simple terms, a cool roof is just a roof that reflects maximum amount of sunlight, and it emits thermal radiation to help dissipate the impact of solar heat gain. So that is what a cool roof is in very basic terms. Now, why are we talking about cool roofs in a session about extreme heat? Is that a cool roof, when implemented on a large scale, can work to reduce the urban heat island effect at a locality level, at a regional level and definitely at a city-wide level. It also lowers air pollution. It has other impacts. It offsets carbon emissions, and it provides, most importantly for our purpose, it provides thermal comfort specifically for the most vulnerable people. Why I'm saying this is that there are various applications of cool roofs, including some very low-cost ones. And it has the potential to improve the comfort of homes, schools, hospitals, public buildings, and so on. This is in an unconditioned building where there is no air conditioning. Even in a building or a room that has sufficient cooling, that has access to, say, fans or coolers or even air conditioners, cool roofs have the potential to improve comfort and to reduce the amount of cooling required. That is, you have to use the AC for shorter periods, or your electricity bill comes down. It reduces the peak load on the grid, and therefore it makes temperatures more bearable, especially during incidences of high heat waves. Now, cool roofs are an intervention that have been increasingly been explored in India over the last couple of years. In fact, it began with pilots in educational institutes in 2017-18 in IIIT Hyderabad. There were experiments done to assess the impacts of cool roofs, and they saw that simply changing the color of the roof from black to white, it results in annual savings of 20 to 22 kilowatt hours per meter cube, which means in terms of energy savings, it increases energy savings by 14 to 26%. So it reduces your electricity bill, as well as it reduces indoor temperature. In Ahmedabad in 2017-18 onwards, there have been pilots for cool roofs, including for low-income housing, low-income houses in slums, in other low-income applications, where the reduction in temperature has been seen of over 3 degrees Celsius during the peak summer. And this is also because many of these roofs are replacing tin roofs, which have the propensity to get heated up very easily. So these are other examples where cool roofs have been used very effectively. So essentially, cool roofs is a low-cost your heat. I think this also was mentioned before. Cool roofs in New York City in 2009 was first introduced as an intervention for low-cost housing, and this is a process that resulted in major learnings for the Indian context. I'll come to that. In India, in 2017 and 18, Ahmedabad and Hyderabad initiated pilot cool roof programs. In Telangana, there is a cool roof policy that is being currently rolled out. In Ahmedabad, more than 3,000 homes have been converted to cool roofs. This has been done in partnership with private sector CSR activities. Cool roofs have also been recognized as a solution in various national level guidelines, including the NDMA's guide to alternate roof cooling solutions. So these are a couple of products that have been knowledge products that exist out there, which I think SNOs can easily refer to get more details. In 2021, last year, the NDMA launched a Cool Roofs Challenge nationally, where cities were encouraged to announce and implement cool roof targets to maximize cooling potential. Now, what are the type of cool roof materials? Very broad. These 4 kinds of materials. The easiest and the cheapest solution is simple whitewash. हमारा जो चूना होता है, चूना अगर हम हमारे छतों पे चूना लगाते हैं, तो white based चूना, that alone has the potential to increase reflectivity and reduce indoor temperatures significantly. However, whitewash is not very durable. Barish वगैरह होती है तो it gets washed away. Similarly, it does not stay for very long. Then there are other fabricated materials like membranes. There are tiled roofs, China mosaic tiles जिसे हम कहते हैं. And there are other kinds of coatings that are now increasingly manufactured. Now, what is the cost of cool roofs? The cost can be from as little as 50 paisa per square feet, which is the cost of chuna, which is extremely cheap, right? You could do it every year. And traditionally, I think ये देखिए ये example है. Traditionally, काफी households में ये होता भी था. अगर आप जोधपुर में जाते हैं, जोधपुर is known as the blue city. It's known as the blue city because it was a traditional practice to paint the houses in a lighter shade of blue, which increases reflectivity as well as acts as a cool roof solution. But other solutions जो है जैसे मैंने बताया, membranes, cool tiles, they have higher costs, often are more durable. ये सारे examples है of the current applications of these. This is a slide comparing the options for cool roof based on various different parameters on stormwater management, on free energy generation, on energy savings, on building cooling, etc. Now we come to the crux of this presentation, which is on healthcare facilities. ये बातें हम यहाँ क्यों कर रहे हैं? The first application that a lot of us here on the call can do of cool roofs is trying to apply it inwards in our own healthcare facilities. And this could be anywhere starting from a PHC to a CHC to your secondary health institutions and tertiary health institutions and medical colleges in your capital cities and your tier 2, tier 3 cities. The potential of this is to reduce significantly indoor temperatures and to increase resilience of your healthcare facilities to extreme heat. Given the infrastructure that we have in India, it is more and more possible that we face severe heat waves like we did this year. And going forward, healthcare facilities especially should prioritize interventions that increase resilience to extreme heat. And this is where all of you can play a very major role. Healthcare facilities may be inherently vulnerable because of several factors, because of their location, where they are located within the city. And this also includes where they are located inside the building. Very often we see that top floor जो होता है वो बहुत गर्म हो जाता है और basement या ground floor जो होता है वो relatively cool रहता है. Similarly, proximity to built-up areas या फिर distance from blue spaces, green spaces. Green spaces बोले तो अगर we are talking about a nicely thickly wooded area जहाँ पे greenery काफी ज़्यादा है, or blue spaces where there is a water body, either a naturally occurring lake or a canal or any open water body like that. If you are too far away from that, that can also make your facility more vulnerable to extreme heat. It can also be determined by the nature of users that go use that particular healthcare facility. Pregnant women, children, infirm or unwell individuals, these are all users of healthcare facilities very often in India. So these factors have been listed here so that SNOs like yourself can identify vulnerable facilities within their own jurisdiction area. अगर आपके अंडर में एक कोई पर्टिकुलर स्टेट आता है या डिस्ट्रिक्ट आता है या सिटी आता है तो उसके अंदर में यू कैन आइडेंटिफाई कि कौन सी फैसिलिटीज में हीट का इम्पैक्ट ज्यादा रहेगा इन कमिंग इयर्स बेस्ड ऑन दीज फैक्टर्स. The second way in which healthcare facilities can equip themselves to deal with extreme heat is to have adequate supplies and equipment to deal with the symptoms of heat-related illnesses and of heat stress. अभी symptoms क्या है ये I think previous speakers ने बहुत अच्छे से explain किया है. किस तरीके से heat impact करता है, इसको किस तरीके से identify करना है और इसके बाद जो अलग-अलग लेवल के institutions हैं, healthcare institutions जैसे primary health है या फिर CHC है, इसमें एडवांस इक्विपमेंट होना जरूरी है, बट इससे भी ज्यादा बहुत एसेंशियल है टू हैव बेसिक सप्लाईज. एडवांस इक्विपमेंट में मैंने स्पेशलाइज्ड नियोनेटल इंटेंसिव केयर यूनिट्स की बात करी थी, बिकॉज दिस वाज समथिंग दैट अहमदाबाद हैड डन specifically for infants and neonates in the heat season. But basic supplies include something as simple as adequate hydration facilities. आपके facility में cooler होना जरूरी है, water cooler or ORS, or access to cold hydration. Second is dedicated IECs, which promote the identification of symptoms of heat-related illnesses and stress. इस पे भी काफी काम हुआ है in the previous years, and I think NCDC is also taking the lead on this. Ambulance and bed availability. अहमदाबाद में हमने देखा था कि काफी जगह पे dedicated wards and bed space was made available for HRI illnesses and HRI victims. And the last point is cooling facilities, जिसमें we are not just talking about cooling but also space cooling, coolers, air conditioners, and अगर ये सब नहीं है या फिर है फिर भी passive cooling का होना बहुत जरूरी है. ये एक case study है which I wanted to highlight in Ahmedabad. Again, by previous speakers, but this is the case of Shardaban General Hospital in Ahmedabad. This is a general hospital which जहाँ पे सबसे ज़्यादा बच्चों की treatment होती है. So it is a child hospital, has a specialization on child treatment, pediatric treatment. इसमें हुआ ये था that the roof, because it was leaking, it had been coated with tar, which to act as a waterproofing material. Excuse me. So tar के चलते उसका heating effect काफी बढ़ चुका था. And what had happened is जो top floor था, जो tar roof के बिल्कुल नीचे था, वहाँ पे maternity ward था. So that was a double whammy. This was again in the year of 2010. They realized that because the maternity ward was on the top floor and because the roof was tarred, the indoor temperatures were 2 to 3 degrees higher. So what Shardaban General Hospital in Ahmedabad did was they put reflective white China mosaic roof, ये जो आपको दिख रहा होगा, mosaic roof जिसे कहते हैं. And इसके चलते there were significant reductions in hospital admissions. ये एक स्टडी है जो 2010 के हीट वेव में हुई थी. Talking about the impacts of this study, and it shows that during 2010 compared to 2009 and 2011, the NICU admissions significantly reduced. So जो indoor temperatures का impact है, that is also a very significant component of healthcare facilities. I'll just come to this. This is a checklist under the national plan that is talking about how healthcare facilities should improve their preparedness or make sure that they behave in a manner that will promote resilience to extreme heat. And this is something that all the SNOs here and the trainers here should definitely prioritize here. यहाँ पे काफी सारे components है, including increased outreach. So इसमें capacity building का component तो आ ही जाता है, मगर अगर आप community health workers जो हैं, जो आशा workers हैं, ANM workers हैं, उनके awareness पे काम किया जाए. And if they are able to ensure that these kinds of solutions such as cool roofs, जो बहुत low cost हैं, उसको promote किया जाए, that will also help in building long-term resilience to heat. This is a checklist that we've built कि जो SNOs हैं वो किस तरीके से engage कर सकते हैं with the city. One is that level से नीचे आते municipal health agencies और district level health responders को identify किया जाए. जैसे मेरे पहले डॉक्टर मावलंकर ने भी इस पे काफी बात की थी about how there needs to be a structure for analysis. Network of professionals, academic institutions हो या फिर research institutions हो या फिर civil society groups हो, उनको loop in करें to identify and to see how your healthcare facilities can be improved. इसके लिए फंडिंग कहाँ से आएगी, ये भी एक काफी ज्यादा बड़ा सवाल रहता है. तो इसमें मैं एग्जांपल देना चाहूंगा अहमदाबाद का. अहमदाबाद ने इम्प्लीमेंट किया इसे काफी ज्यादा CSR फंडिंग को लूप इन करके. एंड द अदर वे दैट दे आर डूइंग नाउ, जो इस साल हो रहा है, इज टू आइडेंटिफाई तो मेम्ब्रेन आ जाते हैं या फिर कूलिंग पेंट्स आ जाते हैं. तो इसके सप्लायर्स को अगर एक आइडेंटिफाई करके एम्पैनल किया जाए तो उसको फिर लोकल गवर्नमेंट, डिस्ट्रिक्ट गवर्नमेंट या फिर सिटी गवर्नमेंट उन एम्पैनल्ड मैन्युफैक्चरर्स को उनको सप्लायर्स के रूप में इस्तेमाल किया जा सकता है और बाकी CSR फंडिंग को इसमें डायरेक्ट किया जा सकता है. तो दिस इज समथिंग दैट SNOs कैन डेफिनेटली डू. इसमें भी एप्लीकेशन कहाँ करना है, इसमें वल्नरेबिलिटी असेसमेंट का बहुत बड़ा रोल होता है. सो जैसे इसमें आई थिंक मेरे कलीग अभियन ने भी पहले बात करी थी, it's important to list existing infrastructural vulnerabilities to extreme heat, and this could be something as simple as कौन से हॉस्पिटल में टॉप फ्लोर पे कौन सा वार्ड है, कौन से व्हाट इज द ग्रीन कवर इन अ पर्टिकुलर एरिया, उसको किस तरीके से इंक्रीज किया जा सकता है, कौन से आपकी फैसिलिटीज है जहाँ पे HRI के इंसिडेंसेस ज्यादा, एडमिशन ज्यादा होते हैं because of proximity to low income areas and proximity to vulnerable populations. Similarly, identifying कि आपके local context में कौन सा solution ज़्यादा appropriate और feasible रहेगा, that is a key component. जैसे हम जोधपुर के का example दे रहे थे, वहाँ पे traditional system of applying light blue paint on your roof is something that can be scaled up very easily compared to other cities. So that was in a short presentation about how healthcare institutions can make themselves more extreme heat. Thank you. I'll look forward to any questions there is.
Thank you, Mr. Polash. Thank you for outlining the various pool of technologies and how it can be used for health facilities and communities, and what is the role of officers. I think I believe there must be questions. We will address them just after a few minutes. The last session is on the group exercise, and Dr. Mahavir will explain the exercises, and I'm sure that participants will go through it and learn something more about how to analyze all-cause mortality with temperature data. So over to Dr. Mahavir.
Thank you, Dr. Purvi. So as mentioned by Professor Mavlankar, that it is very essential to basically correlate your temperature with all-cause mortality of your district or your state, because this will give you idea about that how your basically state or district is affected with temperature, rising temperature, how rising temperature is affecting all-cause mortality in your district. So we have shared 3 exercises with you, and also we have also mentioned that which group has to do which exercise. So we have divided all the state into 3 groups, and we have given you the 3 exercises. So this you can download from the link that has been shared with you from Dr. Purvi. So I'll just sharing you with one template. So basically this is we have given you the exercise. So in this you have maximum temperature, minimum temperature, and all-cause death. So basically you have to you can do weekly analysis, or you can do monthly analysis. So that will give you idea that how your rising temperature is affecting all-cause death or all-cause basically number of cases in a particular few hospitals, or number of heat-related illnesses. So this is just an example. So you can, basically this is 7 days. So you can see on 7th of March, there were temperature is also, about 36 and the deaths were 120. Similarly, like one particular week here, if you will see, so on 27th of March, there was about 150 deaths in a particular block. So similarly, we have given you data of 3 blocks, or you can think them as a data of 3 cities if you are a state nodal officer, and if you are a district nodal officer, so you can consider them as a block. So these are dummy data, which is T max, T minimum, and all cause deaths. So you can do the analysis and you can look into it. And if you require any help, our email would be said by Dr. Purvi to you. You can contact us. So this will basically give you initial idea about that how a particular state or district is affected with heat related extreme heat event or heat related illnesses.
Dr. Mahavir, can you just show the the tools that you use? You select the data, all the 3 columns, and to chart tools.
Yeah, chart tool. I think I have done online.
So you go to chart tools, and then which
yeah,
one?
You have to basically open the Excel. Then you have to click the insert.
Insert.
In insert, you can see various types of recommended charts. In chart, you can use this line bar item. So in line bar item, so first you have to click the period. So for example, I am clicking now. Let me again. Okay, so you have clicked. Okay, date, T max, and all cause death of from March 1st to March 7th. Then you have to click insert. In insert, you have to go to recommended charts. In recommended chart, there are various charts available. So you can look into it, and this is more appropriate. So this is basically, you have to do like this. So you can select various 7-8 different period. For example, few period in block 1, few period in block 2, few in block 3. Within block 3, you can choose 7 days in the month of March, 7 days in month of April, and then May. So we have given you the 3-month data, so you can try and test. So it will give you idea that if temperature is rising, number of deaths, all cause deaths are also rising. In many block, it would not be this same case. Temperature may be rising, but all cause deaths are not rising. Maybe due to insufficient data, or maybe due to more preparedness, etc.
Okay, thank you, Dr. Mahavir. So this analysis, you can share it in our official group, or I have put our email ID. So once you go through it, you can also share how you've done with us. So I think that's it from your side, right, Dr. Mahavir?
Yes.
So we will go through questions. Some people raise hands, so I'll go through them. No, wait a minute. Let me see. Okay, so participants who have raised hands. Just a minute. Mr. Bhupen Bora. So I will let you come to panelist, and you can ask questions. Then Dr. Shrikant and Dr. Homing. If you are there, you can ask questions. Dr. Rohini Kumar.
So one question I think has been asked by Dipankar Maji.
Yeah, please go ahead.
So he has asked, is there any study by IIPH on the correlation of duration of high ambient temperature with all cause death or HRI? So Ahmedabad study is available online. I have also shared the link. It's PubMed link I have shared. Again, I am sharing it. And we also have, if you will search PubMed, Indian Institute of Public Health, Gandhinagar in PubMed, you will also find Nagpur study and other studies as well.
Yes, Mr. Bhupen Bora, you have question. Now you are a panelist, you can unmute and ask. Dr. Oming, Dr. Rohini Kumar, Dr. Randeep Singh.
No, ma'am.
Yes. Yes, please go ahead.
Ma'am, no question.
Okay. Okay. Anyone else? If anyone else has a question, please raise your hand. I will try to put you on the panel. No? Okay. Okay, I think nobody has any questions now. So I'll just let participants know that these things, this recording will be available online, and PPT will also be available on our website. And with the information that is shared today, I think you got a very detailed information about how to draft action plans and how to, there is one question about market availability of sheets for pool roofing. Dipankar Manji sir is asking. Polashji, you want to answer? Market availability of sheets for pool roofing.
Yeah, Mr. Deepak, I think so these sheets and membranes, they are available in the market, but there are a specific number of suppliers, and it's important to aggregate demand for this case, especially when we are talking about healthcare institutions. So state to state, so we have worked, like we said, we have worked in 4 states so far on implementation of these cool roofs, and they are available from commercial manufacturers.
Okay. So with that information, I suggest that all of you to go through whatever level action plan that you are working on. And as you know that we all heard about Ahmedabad case study, but after that many states have done a lot of work in terms of extreme heat impact. I would like to also emphasize that we talk about passive cooling. So active cooling is like using AC and fans, which again puts a burden on electricity grid. So we are more about passive cooling methods, and cool roof is one of them. So now at closing, I would just like to say that, you know, climate crisis is health crisis for the right reason, that we are all affected by it. And so the learning that you have today, we hope that you spread it, you sensitize more and more people and become leaders at your own level, because that's what we need, health-centric approach for climate response. So I'm sure that you will all, are more informed and more empowered to take action at your own level. So with that, I thank you all the participants and panelists for taking their time and sharing a lot of useful information. Thank you. So we have more questions. Can we implement next level? I think we will take that. I will answer that later, Dr. Prashanta. Okay. All the best and have a good evening, everyone. We'll end here. Thank you.
Thank you, Dr. Prabhu.
Thank you.